session of PSN. Today, in this session, we will discuss all the health programs of India along with their images and logos. Then we will move to discuss the BASTA topic, which I have to discuss in with examples of numericals and all. Then we will go to discuss occupational health, international health, and entomology topics. So let's start with this question. This is a new type of interesting question which they ask, that if I want to know whether leprosy program is working well in our area or not, which indicator I will use out of the 4? And the question is, which indicator is not used for knowing the impact of leprosy? मतलब leprosy program का असर पड़ रहा है कि नहीं, ये किससे नहीं पता चलेगा? So if we are looking at annual new case detection rate, it is one of the best indicator which will tell whether leprosy program is working or not, because if new cases are less, it means leprosy program is working well. Second option is new case detected with grade 2 disability. It can also tell us whether leprosy program is working well or not, because if leprosy program is working well, then they will identify the cases early and grade 2 disability cases percentage will be less. Option C is number of multibacillary leprosy case, and option D is number of leprosy patient with relapse of leprosy. So if relapse is occurring, it is indicating that follow-up is not done perfectly. For paucibacillary, in which there is less than or equal to 5 skin patches, we do follow-up for 2 years. For multibacillary, we do follow-up for 5 years. So if relapse is there, it means follow-up is not there, and that means program is not working well because relapse is occurring, follow-up is not there. Therefore, the only option which will not tell us impact of leprosy program is number of multibacillary leprosy cases. This will not tell about impact. Why? Because multibacillary leprosy is just a type of leprosy. It will not tell us whether leprosy program is working well or not. इससे बस ये पता चलेगा कि बीमारी गंभीर है या सिंपल, ये लेप्रोसी प्रोग्राम काम कर रहा है कि नहीं, ये नहीं बता पाएगा. It will only tell us the severity of leprosy. It's a stage of illness. It will not tell the impact. Now the second very good question which came from the same 4 option is that if I want to know whether leprosy case detection is occurring properly or not, people are detecting it properly or not, out of the above 4 indicator, which one will be best to use to know whether leprosy case detection is occurring on time or not? So the best indicator will be, what do you think? What is the answer? What do you think? The best indicator will be, yes, Meenakshi Haridas and Irfan Alam is correct in answering. Best indicator is new case detected with grade 2 disability. Because if many people are coming with grade 2 disability, it means we miss them when they develop leprosy and we are detecting them very late. So it means leprosy case detection are not occurring properly. So leprosy case detection occurring properly or not, this will tell us detected by percentage of patient with grade 2 disability. Okay. So this will tell us detection, and impact will be told by A, B and D, but not with C. Multibacillary leprosy case will not tell the impact. Okay. Now let's discuss some of the points in multibacillary leprosy which they ask in exam. One thing which we were discussing is paucibacillary is less than or equal to 5 skin patch and the treatment duration is only 6 months. Follow-up is 2 years. But with multibacillary, the treatment is of 12 months and follow-up is of 5 years. And this should be more than 6 skin patch. In a recent exam, they have asked that which drug of leprosy lead to darkening of skin. So remember this thing, this is clofazimine, which lead to 2 side effects. It can lead to darkening of skin and it can also lead to opacification of lens. So that is why earlier in paucibacillary clofazimine was not given. So if patient is getting darkening or if there is cataract-like changes in lens, it is due to clofazimine. Second, one more extra question they can ask from here is that what is the drug of choice for lepra reaction? What is the drug of choice for lepra reaction? And when you are treating lepra reaction, will you stop giving multibacillary therapy or will you continue giving therapy of leprosy? So the drug of choice is methylprednisolone. And try to guess it. Will you stop leprosy treatment or not? We don't stop MDT, because if you will stop multi-drug therapy for leprosy, then only steroid can flare up leprosy. You know, if you will stop the drug and only give steroid, that can lead to exacerbation and excess of leprosy disease symptoms coming out. Okay, so we will not stop the treatment. Now, one more thing we all have to know always is that India has eliminated leprosy in 2005. Although 2 lakh new cases of leprosy were reported in 2019, but still we have eliminated in 2005. So how both of these is possible? Because we call leprosy as eliminated if there is less than 1 case per 10,000. The same criteria, if you ask the criteria for elimination of filariasis or elimination of neonatal tetanus. Filariasis has not yet eliminated from India, but neonatal tetanus has been eliminated from India in 2016. So for both of them elimination, the criteria is less than 1 case per 1,000. But for leprosy, the criteria is less than 1 case per 10,000. So the criteria is different. And for filariasis elimination, we do TAS. TAS stands for Transmission Assessment Survey, in which we check whether case is less than 1 per 1,000 for 5 years, and microfilaria larva concentration should be less than 1%. Then we say filariasis is eliminated from that area. Again, the best indicator for impact, if they ask, best indicator is annual new case detection rate. And in India, annual new case detection rate is 9.7. And why India has eliminated leprosy? Because although we have many cases of leprosy, but if you look at per 10,000 population, our prevalence of leprosy is less than 1. We have eliminated. Okay, it is 0.66 prevalence of leprosy. Now, next question they ask is, how will you make the diagnosis of leprosy? Nikhil, how will you make the diagnosis of leprosy? So, for the diagnosis, we can take the biopsy, but it is not compulsory to diagnose it with biopsy, because in tribal areas and all, you can't do judgment smear so easily. So in those areas, if these 3 symptoms are there, loss of sensation of his over skin patch, thickened nerve, and depigmented patch, these 3 symptoms are there, diagnosis is confirmed. Okay, so they can create this option: loss of sensation over depigmented patch and thickened nerve. Okay, so if these 3 symptoms are there, diagnosis confirmed. And government is doing disability prevention, medical rehabilitation for leprosy patient. They are giving them microcellular rubber footwear so that they don't develop cut and all. And if they give you an image of patient where leprosy or filariasis patient foot care is done, then that is definitely example of tertiary prevention, because tertiary prevention include disability limitation. And when we are doing foot care, it is mostly to limit the disability. Okay, so that's why it is tertiary prevention. One more thing is SPURS, and not SPURS Gupta. This SPURS is the healing touch. And in this program, government is trying to tell the people that if you treat leprosy patient for 2 months regularly with MDT, they will not transmit it to other people. So we need not to throw leprosy patient away from their home. Okay, so these are some of the point and interesting new question which came from leprosy. I hope you will remember it. A school health program is a very frequently repeated question these days. Do remember, nowadays school health program also come under Ayushman Bharat. And of course, Ayushman Bharat, along with Ayushman Bharat, the school health program also come under PHC Vision Center. Because in a school health program, teacher go and screen for refractive error. And screening is the work of PHC. So that's why school health program come under PHC Vision Center. Now, why Ayushman Bharat is taking care of a school health program? Because in a school health program, a new thing has been done. They will celebrate Health and Wellness Day on every Tuesday. Okay, every Tuesday they will celebrate Health and Wellness Day. And we will later on read that in Ayushman Bharat, there is health and wellness center. So health and wellness center in Ayushman Bharat, that's why they also included school health program under Ayushman Bharat. So what they will do on this Tuesday, they will motivate student for yoga and meditation. Because yoga se sab hoga, hai na? And for motivating them, they will choose one boy and one girl from each school as health and wellness messenger. They will also choose one male and one female teacher, not for couple yoga or couple dance, but to work as health and wellness ambassador and to train students in yoga and meditation. Okay. But main thing which occur in school health program is teacher does screening of 4th to 8th class children for refractive error using Snellen chart. They will hang the Snellen chart and ask the student to come in line one by one, close one eye, read what is there, close another eye, read one from there. And then if any child refractive error is less than 6/9, then they will refer the child to higher center. Okay. But do remember this two important point, that how much space is given for every student. The space is only 10 square feet for each student. And the same space question they can ask in occupational health. In occupational health, the space is 500 cubic feet. And this space is counted only till 14 feet above their head, not after 14 feet. Otherwise, some smart-minded industry people, they used to keep the rooftop very high. And they used to say, now it is 500 cubic feet because rooftop is very high. But no, you have to measure it only till 14 feet above their head. And of course, you all know that in the school health program, there is minus desk, which will prevent them from backache. So it is example of specific prevention. Every class 40 student, one urinal for 60. And if you mix student with susu, it will become potty. 40 plus 60, student plus urinal susu is potty or latrine, 100 student. Of course, 25% area should be door and window and light should come from left side. Do remember Health and Wellness Day on Tuesday. Therefore, it come under Ayushman Bharat. Then there is one small program of NPCDCS. They can ask what are the 4 diseases under it. That is cancer, diabetes, CVD and stroke. Then they can also ask that what are the work which is true or false about NPCDCS. So under NPCDCS, sub-center cannot start treatment because they don't have MBBS doctor, but they can continue the medicine. And they also do the work of health promotion. This health promotion is the responsibility of new employee CHO at sub-center. CHO means Community Health Officer. It's new employee which will train villager in yoga. Because yoga se sab hoga. And then there is also a work of measurement of RBS and BP. So this question came in INI-CT, that will they measure fasting or random blood sugar in sub-center? Random, because villager wake up at 3-4 a.m. in the morning many a times. I don't know why. And it's difficult for them to keep fasting for 5 to 6 hours. So they will only measure random blood sugar at sub-center. Then at PHC, we can start treatment because at PHC, we have an MBBS doctor most of the time. And then 1 day per week, there is separate OPD for NCD patient at PHC. At CHC, the OPDs are at 5 days per week for NCD, and CHC can also do treatment of complication, and CHC can also send nurses to home of patient who are bedridden or having hemiparesis. So they will ask true, false. Like which of the following is false? PHC does treatment of complication, false. CHC does health promotion, false. Health promotion is the work of sub-center. Complication is treated in CHC. PHC have 1 day per week separate OPD for NCD. Correct. CHC have 5 days per week separate OPD for NCD. Correct. So like that they can ask, they had asked already true false type question from here. Other than that, we have already discussed that if they ask most common cancer in world, that is breast cancer. Most common cancer in female of India or world, again you have to answer breast cancer. Most common cancer in male of India, oral cavity, and most common cancer in the worldwide is lung cancer. In male, if they ask, then it is lung cancer. But if they ask overall in world, you have to answer breast cancer. All this information given in the table in PARC. So it's if any other subject teacher tell you otherwise, trust PARC here, because collection of data from public is the work of PARC. So you can trust it there. Now let's read some important point from I program, because Opthal and PSM both ask questions from here. So if you are in OPD, 6/9 written on patient OPD card. What does this 6 stand for? Is it for patient or for normal person? The 6 is for patient. 6/9 means what patient can see from 6, normal person can see from 9. So they can ask, what is the most common cause of visual impairment? Student answer cataract, they are wrong. Visual impairment or low vision is most common by refractive error. Cataract is most common cause of blindness, because refractive error can occur at any age group, in children, young age like you people, or old age, you know. So cataract can lead to blindness, but most common cause of low vision is always refractive error. And if they ask most common cause of blindness in children, of course in children the most common cause will become vitamin A deficiency. Okay, now the definition of blindness is not less than or equal to 3/60, it is less than 3/60. Less than 3/60 in better eye with available correction is blindness. And this same definition is of social blindness. So whenever they say social blindness simply means blindness. Okay, social blindness is the blindness. Now we have to focus on the classification, and classification is very easy to remember if you use the mnemonic LESMA, choti ma, and not lesbian ma, but LESMA, small mother. L stand for low vision. Low vision start when it is less than 6/18. Economical blindness is when it is less than 6/60. And then again, social blindness is less than 3/60. I discussed social blindness is the real blindness. Then if there is manifest blindness, it is less than 1/60. And if this is absolute blindness, batti bujh gayi, then there is no perception of light present. Absolute. So that's why the mnemonic is LESMA. Low vision, economical, social, manifest, absolute. But what you have to remember is low vision less than 6/18, economical less than 6/60. Like that, remember. Low vision less than 6/18, economical less than 6/60. Social, you already remembered, is the same as blindness. So then you will remember the whole classification. The question is, if they ask this type of confusing question, that visual acuity is 3/60 and 6/60, in which category patient will belong? Can you answer this question? 3/60, 6/60. Which category patient will go to? So to answer such question, you have to look at the better eye. Which one is better? 3/60 is better or 6/60 is better? Better eye is 6/60. So better eye after using available correction, if cannot see less than 3/60, then that is blind. So here we have to look at better eye, which is 6/60. Where will you put this patient? Please reply if you can. And this is an interesting and confusing question. By looking at 6/60, people reply it is economical blindness. But economical blindness, when it is less than 6/60, then it is economical. So till 6/60, we put the patient in low vision, and therefore the answer will be low vision. Do remember it here. Till 6/60, it is low vision. Okay, till 6/60, low vision. Now, similarly, they can ask if visual acuity is 1/60, 3/60, where will you put it? So as soon as people will see 3/60, they will put them in social blindness. But no, social blindness is less than 3/60. So if it is 1/60, 3/60, better eye is 3/60, and you will place this patient in economical blindness. Okay. So this is the Indian classification, LESMA. I hope you will remember and you will do this tricky question easily. Now the WHO classification had one extra point, mild low vision. Mild low vision is when it is less than 6/12. One extra added. After this, everything is same. Moderate low vision is the low vision of India, less than 6/18. Severe is economical. Blindness is social blindness. Do remember this point. Even if you forget all things, do not forget what is social blindness. Then less than 1/60 is blindness category 2, which we call as manifest. And blindness category 3 is absolute in India, and here it is blindness category 3. So the Vision 2020 was formulated to reduce the burden of blindness to less than 3 per 1,000. And in Vision 2020, 3 diseases are both in India list and in WHO list. They are cataract, refractive error, and childhood blindness. World deal with trachoma, we deal only with trachoma, which is in the upper eyelid, focal trachoma. World, especially African country, have onchocerciasis or river blindness, but it is not in India now, because in African country the water crisis is more severe than India. So many people go to river to wash their clothes and do hanky panky, and when they are doing hanky panky and all, this black fly come and sit in their eye and cause rapid granulomatous destruction. Within 1-2 months they become blind with that. So this onchocerciasis is something which is in Africa but not in India. That is why it is in WHO list but not in India list. In India list we have these three things: diabetic retinopathy, glaucoma, corneal opacity. WHO focus on 5. We are more developed, so we focus on 7 illness. Diabetic retinopathy, glaucoma, corneal opacity are the 3 extra one in India list, which are not in WHO list. Okay. So for trachoma, they keep asking this question: what does safe strategy mean? S stand for not sanitation but surgery, and surgery is to remove the hair which has gone inside the eye, correct the trichiasis. Then after surgery they give 1% azithromycin as antibiotic of choice. Facial hygiene, not F for fuck off, and E stand for environmental cleanliness. Now to achieve this less burden, what they did is they made a plan that 20,000 PHC should be made vision center, 2,000 PHC should be made service center, which will be at CHC, 200 will be training center, 20 will be center of excellence. So to remember these things, it's very simple. First thing is Vision 2020 start with Vision Center. So first base is Vision Center at PHC 20,000. And then you keep reducing 10 at each. Service will be 2,000, training will be 200, and Center of Excellence will be 20. VSTC, Vision Service Training Center of Excellence. The mnemonic is VSTC, Vision Service Training Center of Excellence. And of course, then the Apex Center, which is at AIIMS New Delhi. So, we already discussed that school health program come under Vision Center of PSC and Ayushman Bharat. But they can ask this thing, that who is the head of eye program or disaster management program at district level? Is it district collector or a medical superintendent or CMO? So we will make that person head in eye program who know the less about eye thing, so that he will not use the fund and send it back to the government. So that's why the head made is district collector. Both disaster and eye program head is district collector. And government is saying there should be no cataract surgery in camp. One reason is camp surgery will lead to more infection. Second is, if there is camp surgery, there is no one to follow up on the next day. So camp surgery not allowed. And cataract surgery rate is not a true rate. It's not a true rate. It simply means that for every 1 lakh population, at least 400 cataract surgery must be done per year. Okay, so cataract surgery rate is not a true rate, but it's just measure that per lakh population in a year, how many cataract surgery has been done. It should be minimum 400. Okay. Now, after eye program, let's have a look at the HIV program. In the HIV program, first thing is, what is the most common route of HIV transmission? As soon as I ask is, most of the students answer blood transfusion. Then some answer sex. Which thing you will do most commonly in your life? Sex or blood transfusion? Of course, blood transfusion you will not do many times, but sex you can do thousands of times. So most common will be unprotected sexual intercourse. But if they ask route with maximum risk, then the answer is blood transfusion. Okay. After blood transfusion, second number is vertical transmission, mother to child. Then there is intravenous drug use and anal sex. These are the high risk route of transmission. To know whether HIV is decreasing in our country or not, we do HIV sentinel surveillance. So they can ask, sentinel surveillance is for hidden case, for notified case, or for all case. Active surveillance is for hidden case. Like in case of malaria. In malaria, MPW, multi-purpose worker male, mostly, they are going door to door and they are asking, does anybody have fever in the house? If anybody say, yes, I have fever, they will take the blood and they will make 2 blood smear. The question which came in INICT was, what does thin blood smear tell about? Does thin blood smear tell about species of Plasmodium, or does it tell about the presence of Plasmodium? So thick blood smear will have more blood. That will tell whether Plasmodium is present or not. Thick blood smear. Thin blood smear will detect the species. Okay. And when they are detecting the species, if you found either banana-shaped gametocyte or headphone type, both are indicating falciparum. Both are for falciparum. Okay. Inside RBC, if you find any of these two, falciparum, and it is detected by thin blood smear. But if you found a granulated RBC with granules inside and all, this will be for vivax. Okay, so do remember that. So what is the MPW is doing here? MPW is going and searching for hidden case of malaria in the people. So MPW is doing active surveillance for hidden case. Okay. Then there will be some case of malaria which will come to hospital by themselves. They will be known as passive case. That is passive surveillance. And those cases who will come to hospital, we will make their report and we will send the report under IDSP program. So passive surveillance is for notified case. And if you mix active and passive, that will become sentinel. So sentinel is for all case. And why we are doing sentinel surveillance? To know whether HIV is increasing or decreasing in any area. Like let's say in Bihar, I want to know HIV is decreasing or not. So what I will do? Every year, I will test 400 ANC mother, 250 high risk group people, 250 bridge population people. And in this 900 people, if this year prevalence of HIV came 0.2, and last year suppose it was 0.25, it means HIV prevalence is decreasing in Bihar. So every year we will test them and tell the trend of HIV. So who belong to high risk group? Does doctor belong to high risk group of HIV? Hey, don't give yourself so much of value. You need to perform more to come in high risk group. Sex worker come here in high risk group. Other than sex worker in high risk group, we have intravenous drug user, transgender, and MSM. What is MSM? आदमी हूं आदमी से प्यार करता हूं. Male having sex with male. So these four come under high risk group. Bridge population involve single migratory worker and long distance truck driver. So why we call them bridge population? Because they stay away from their wives for a long time. They can be married or unmarried. Single migratory doesn't mean unmarried. Single means married or unmarried who is staying away with their wife for a long time. So some of these migratory worker and long distance truck driver, they go to sex worker, and sex worker are mostly living in a separate part of society. They take the HIV from those sex worker and then infect their innocent wife back at home and transfer the infection from separate part of society of sex worker to the main society, the general population. That's why they are known as bridge population. Okay. So tell me one thing. Every month I also go to take class in Jaipur, Tamil Nadu, Kerala, or sometime out of India also for 10 day, 15 day in Philippines, Ukraine, no, not Ukraine yet, like Philippines, Kyrgyzstan, Tajikistan and all. So am I a migratory worker? What do you think? Okay. Am I a migratory worker? So the answer is I am not a migratory worker because our duration of stay is small. It needs longer duration in months to become migratory worker. So these two people, high risk and bridge population, they will be tested by active surveillance. And ANC mother are coming to us by ourselves. And there are 5 compulsory tests which is done in ANC also and during blood transfusion also. What are those 5 tests? Very simple to remember. HIV, Hep B, Hep C. Then 2 more are malaria and VDRL for syphilis. So only 2 you have to remember. 3 I think you already understand that it should be done. Malaria and VDRL. Total 5 tests done in ANC and in blood transfusion also. So they will come by themselves and they will be tested whether positive or negative. How do we test them? To test these 2 groups, high risk and bridge, we use opt-in testing, But to test ANC mother, we use opt-out testing. I think you know what is opt-in, opt-out testing. Okay, imagine me as a transgender. Okay, so I'm a transgender and you came to me. Why you came to me? To test me, है ना, for HIV. So if you came to me, first you will ask for my permission. क्या मैं ले लूं, है ना? Should I take it? Then I will say कि ले लो, take it. I will give you permission. Then you will take my blood sample, na? So that means I am opting in. But ANC mother are already in the panel of test. So if someone is already in the panel of test, they cannot opt in further. They can only opt out. So opt-in testing is in these two and opt-out there. One of the INICET question asked on this topic was, which of the following do not come under HIV sentinel surveillance? So remember, sex clinic attendants, STD patient do not come under this surveillance. 7 people come under it. Sex worker, IDU, MSM, transgender, 4 are high risk. Bridge population and migratory and long distance truck driver, and last is ANC. 7 people come under it. Okay. Now, one more question they ask is, what is this moderate prevalence state? Moderate prevalence state simply means that HIV in high risk group should be more than 5%, but HIV in ANC should be less than 1%. Let me clarify this thing because it can get confusing under exam pressure. Which thing is more dangerous? If out of 100 sex workers, 6 are HIV positive, that is more dangerous. Or out of 100 pregnant women, 2 are positive, that is more dangerous. More dangerous is 2 mother out of 100 mother, because sex worker are in a separate part of society most of the time. So in them, if HIV is more, it means it has not spread to general population yet. Okay, in them it is more, we can control it. But if 2 ANC mother is positive, it means HIV has spread in general population, that is more dangerous. So HIV in ANC, remember, ANC is more dangerous to have HIV positive. That's why it should be decreased first, less than 1%. Okay, and high risk group can be more than 5%. Whenever they ask table from this classification in objective exam, they only ask this moderate prevalence. Okay, high risk group more than 5%, ANC less than 1%. And how do we provide the medicines for HIV? So to provide the medicines, we have ART Plus Center, ART Center, Link ARTs. ART Plus Center is at Medical College, where we give 3 facility: CD4 count, first generation ART. First generation ART means given to those patients who are not drug resistant, and second, third generation ART. This is ART Plus Center. Now, ART Center is at district hospital. So try to apply your logic and tell me that out of these facilities, these 3 facilities, which facility do you think will not be available at medical college, will not be available at district hospital? So at district hospital, you cannot give treatment to drug resistant HIV case, because to give this treatment, you need a microbiology lab and an MD medicine, which are many a time not present at district hospital. So district hospital can do CD4 count and give treatment to those patients who are not drug resistant, first generation, but district hospital or ART center will not have second, third generation ART. Now, last thing they ask is Link ART center, which is below ART. So below district hospital, what comes? CHC. So Link ART center will be at CHC. And which is more important? Testing is more important or giving treatment is more important? Always remember, giving treatment is more important than testing. Therefore, we are giving the treatment at the last center. Testing is not important, because if test is not done, then we can send the patient from village to city to go get the test done. But if medicine is not given at village, then patient might develop drug resistant HIV. So we focus on giving treatment more. And anyway, at what CD4 count we start treatment for HIV? At any CD4 count, start HIV treatment if patient came positive. So anyway, CD4 count is not needed anymore for starting treatment. Therefore, what is the last thing we are giving at Link ART center? Only one thing, first generation ART. Okay. Now, they can ask this question, what is standalone ICTC? stand alone, akela khada, will have own separate staff. Stand alone will have a separate staff standing alone. Like that you can remember. Then facility ICTC, facility counseling and testing center, they will not have separate staff. They will have integrated staff. And mobile ICTC, there will be a van going. And of course, there will be no separate staff for that. Okay. And this is for vulnerabilized marginalized area. So separate staff of testing is there in standalone ICTC. And counseling and testing, if they include the word testing, they are doing screening. Therefore, it come under which level of prevention? Primary, secondary, tertiary. Testing means early detection. And early detection and diagnosis is secondary. So counseling and testing center for HIV will be example of secondary prevention because it will make early diagnosis. Now, let's come to the treatment of HIV. Of course, it's a pharma topic, but we can discuss it here. Very easy to remember. HIV, if occur to you, you are a limited edition person. Na? So the drug is lamivudine, tenofovir, dolutegravir, LTD, limited edition. Now, in children, T stand for tough, let's say. So, in children, can we give tough medicine? No. So, we replace tenofovir with abacavir, and rest lamivudine and dolutegravir are same. Okay. So, the adult treatment is limited. Children, we call the maa ka ladala, we call it lad also. So, children lad, adult limited. Now, one question came in recent exam that which if a mother or if a female is taking HIV treatment and TB treatment both, then which drug concentration should be increased? So in TB drug, there is rifampicin given. And rifampicin, as you all must be knowing, rifampicin is an inducer enzyme inducer. So rifampicin enhance metabolism of many other drugs. So if we are giving TB and HIV both, then dolutegravir concentration should be increased. Dolutegravir should be given more concentration. Okay? Because rifampicin will metabolize dolutegravir. So we need to increase the concentration of dolutegravir. But if there is one problem with dolutegravir, it can cause neural tube defect. So in pregnant lady, if we are giving dolutegravir, Park has written, also give high dose of folic acid with it. Or you can replace dolutegravir with raltegravir. Okay, but Park has written, increase the dose of folic acid in such female. Now, one question has already came in infant. What are the 3 medicines which we give for treatment of HIV? So first thing which we give is nevirapine. As soon as the child is born, we give nevirapine 2 mg per kg per day. But nevirapine is hepatotoxic, so we cannot continue it after 6 weeks. Therefore, after 6 weeks, we move to lamivudine and zidovudine. So what are the 3 drugs given till 6 months? Zidovudine, lamivudine, nevirapine. Okay. But if they ask only 2 drugs, the better answer will be lamivudine, zidovudine, because these are the drugs given from 6 weeks till 1 year. Okay. And if child CD4 count is not increasing with these 2 medicine, we can add raltegravir if needed. So remember, limited for adult, lad for children, and जिसको भी HIV हुआ उसके तो L लग गए ना. If you develop HIV, you are in a limbo state ना, लटक गए ना. So L is there for sure. Lamivudine is for everyone for sure. If you got needle prick injury, which most common cause is recapping of needle, but practically the most common cause is when you do suturing and in place of using forceps, you dig out from your hand, then you develop needle prick injury. So I have this request from all of you. Whenever you are doing suturing, never use your own hand to pull out the needle. Because if you pull out needle from hand, one thing is you will never become perfect surgeon. This is so easy that you will develop this habit of pulling it with hand. Second major problem is prick can happen and you can develop HIV. So if a senior is forcing you to do suturing quickly and he is saying you to use hand and do it quickly, then say it to senior that if I will use hand, I may develop HIV due to this suture pricking me. Then I will come and I will do sex with you. Are you ready for that? It's not an offer, it's a threat. So of course, the senior will understand that it's a wrong practice and you should never pull needle with your hand in suture. Please don't do that. I have done it many times, so I'm preventing you from doing that mistake. So when you will take this injury due to any reason, if you got injured, within 72 hours, you should start post-exposure prophylaxis and it should be taken for 28 days. Park has written that the 3 drugs which we give is Rahul 10 EMI. And suppose Rahul is a guy who took a Lexus car in 10 EMI and then ran away. So Park has given this 3 drug, Rahul 10 EMI, Rahul Tegravir, tenofovir, imitricitabine. But WHO guideline write many a time that we still give limited drug. That means lamivudine, tenofovir, Rahul Tegravir. So if you follow WHO guideline, this is there. If you follow Park guideline, that is there. Mostly that's why they are not asking the drugs of post-exposure. They ask the duration, 28 days, within how many times? 72 hours. And then we do HIV DNA PCR testing at 6 weeks and 3 months to confirm whether you got infected yet or not. Now, what is PPTCT? PPTCT means prevention of mother to child. For that, if suppose I am a pregnant mother and you tested me and in first trimester I came positive, will you start medicine from first trimester? Answer is yes. Be ruthless, start medicine from first trimester because this is the matter of my kid. And at what CD4 count you will start treatment? At any CD4 count, doesn't matter. And we will continue it till lifelong, jhinga lala till death. Do we do cesarean section compulsory? No, not compulsory. Do we allow breastfeeding? Answer is yes, till 6 months. Do we allow food along with breast milk after 6 months? That means, do we allow complementary feeding? Yes, we allow complementary feeding. And of course, we start nevirapine, 2 mg per kg, give it till 6 weeks. Then we replace it with zidovudine plus lamivudine. Okay, from 6 weeks till 6 months. Now, we are done with HIV programs. Let's revise the TB program. In TB program, one thing they ask is about IND TB strategy, National TB Elimination Program, and SDG target. So it's very easy to remember. Whatever is the target of our program in 2025, these are the same target of Sustainable Development Goal to be achieved in 2030. Like SDG said that world will eliminate TB by 2030. So India said कि अगर फेंक ही रहे हैं तो बड़ा फेंकेंगे. If we are throwing, we will throw big. India said we will eliminate it in 2025, and 5 years earlier than the world. So the first target is that all these 3 agencies, they say that expenses due to TB should be 0. Catastrophic expenditure means so much of money spent on TB that person's socio-economic status become 1 class low. If someone is middle class, they become lower middle due to spending money on TB treatment. So that should be 0. No one should spend too much money on TB. So simple, 0 catastrophic expenditure, target is 0. Now, which one is easy to decrease? Death is, mortality is easy to decrease, or new case is easy to decrease? See, TB case occur due to malnutrition or immunocompromised condition. 40% of Indians are infected with TB. Most of the students, you are definitely infected with TB already. Problem is not infection, problem is disease of TB, which is in 210 Indian per lakh population. So when infection person become malnourished, then disease develop. So to control disease, we have to control malnutrition, which is very difficult. Therefore, mortality is easy to reduce. So mortality will be reduced 90 to 95%, but cases will be reduced 80 to 90%. How will you remember? 80, 90, 95. 80, 90, 95. 80 and 90 are the target for case, which is more difficult to reduce, and 90, 95 are the target for mortality, which can be easily reduced if hospital system become well. Okay, so 90, 95 is mortality target reduction, and 80, 90 are cases reduction target. Now, what is this new work which has been done is there is a TB health visitor which will be recruited at every 1 lakh population in urban slum area for detection of hidden case of TB, active case detection. Okay. Second thing is intensified case search or provider initiated testing. They are asking a lot of questions from here. Like, who are the provider of TB drug? You people. You are the one who do the case search and provide medicine. So the government had said that with every HIV, COVID or diabetes patient, all doctors should ask 4 questions. First question, रात में पसीने छूटते हैं क्या? Do you have sweating in night? Because in daytime fever can be controlled with paracetamol, but if patient is having TB fever, in night there will be sweating, and so that will be asked first. Second thing you will ask is, कपड़े ढीले पड़ गए हैं क्या? Are you having significant weight loss? And more than 5% in children, more than 10% in adult. Third question we ask is, do you have hemoptysis? And fourth, do you have cough for more than or equal to 2 weeks? If answer to any one of these 4 symptoms came positive, then in HIV, COVID and diabetes, we don't send patient sample for ZN smear. We directly send it for CBNAT. Do remember this point, that in 5 people, first test done is directly CBNAT, not ZN smear. What are those 5 people? HIV, diabetes, COVID-19. Okay, HIV, diabetes, COVID-19. Other than that, 2 more people are previously treated TB and pediatric TB suspect. Because if it is previously treated, then there can be drug resistance, and this is the main advantage of CBNAT. It not only detects TB, it also detects rifampicin resistance. So in one test, we will know both about resistance present or not also. Therefore, we do CBNAT directly in previously treated. Why we are doing CBNAT in pediatric TB? Because, you know, children, if you will ask them to spit, they will urinate. If you will ask them to urinate, they will spit. So it's very difficult to collect sample in them. Therefore, the sample which has been collected with difficulty, we don't want to waste it in ZN smear, and therefore we directly do CBNAT in 5 cases. Okay, do remember them. Now, Virat Chotalya, Dr. Virat is saying that, sir, predicted question paper of PSM in NEET PG ka video daliye. Okay, dear, I have done one video on this predicted question, which was 2 months back. And I want to, because UPSC, FMG, all those recent exam has occurred, and I will create a very good guess paper of only 50 questions. 50 expected question I will create. And this 50 expected question we will discuss day after tomorrow. And a day after tomorrow on live session. That means it will be on, today is Wednesday, so it will be on Friday. 50 expected question for NEET I will give, and I am sure that out of those 50, at least minimum 5 will definitely come directly, and from the topics 10 will be there. I will try to do it definitely. Virat, thank you for remembering me and asking it to do that. Okay, now Lakshman is asking, can you send the workbook? Yes, on Telegram group, whose link is in the chat box. I will send the workbook PDF, so you can join the Telegram channel and you can get that PDF. Now, coming to the other part of TB, first thing is, we all know that out of 2, 1 sputum sample should be positive. They have asked this tricky question, how do you label it? X, Y, small a, small b, in INICET they have asked. So we label them capital A, capital B. Early morning, like you all know, as soon as patient come, we ask them ki thuk do, give a spot sample, that is capital A. And then we ask to bring the fresh morning sample of next day as a gift for me. That will be B, capital B, early morning. And if anyone is positive, we start treatment under lab confirmed TB. But they have asked this question 3 times already in NEET exam, that if you did 2 sputum sample and both came negative but X-ray is suggestive of TB, then the next thing we do is CBNAT. If ZN smear is negative, we will move to CBNAT. Now, what are the category of treatment? We all know non-drug resistant treatment is divided in intensive and continuation. Intensive phase for 2 months with 4 drug HRJD, which is given daily by 1 tablet, in which all drugs will be there. That's why it is known as fixed dose combination. And in continuation phase, India is giving 3 drug HRE for 4 months. So total duration is 6 months and treatment is given daily. Now let's talk about drug resistant TB. If it is drug resistant due to isoniazid, we will not give isoniazid, and the treatment will be RJD plus levofloxacin for 6 months. If it is MDR TB, in NEET they have asked already, what is the definition of MDR? MDR means at least 2 drug resistance should be there. Isoniazid and rifampicin both should not be working there. list. These two should be resistant. And what is XDR? XDR means MDR should be there, plus resistant to fluoroquinolones like levofloxacin, sparfloxacin, gatifloxacin, ofloxacin, like that, and plus resistance to 3 injectable aminoglycoside AKC, which is amikacin, kanamycin, capreomycin. So if all these 3 criteria are fulfilled, then that is XDR-TB, extensive drug resistance, and these cases are definitely found in India. These are the cases which are there. Now some definition question can also come. Like they can ask you question, when do we call a patient of TB to lost to follow-up? So lost to follow-up is said if the treatment is discontinued for more than or equal to 2 months. If you are discontinuing treatment for 2 months, lost to follow-up. What is a new case? New case is the one which has not taken treatment in past, or if taken treatment, the duration is less than 4 weeks. Previously treated are all those who have taken treatment in past for more than 4 weeks. Now let's suppose I am a migrant worker from Bihar, and suppose Sushant is my treating doctor. He is sitting in Bangalore, and I came to Dr. Sushant and said कि डॉक्टर साहब हम जा रहे हैं बिहार, हमको अपनी मेहरारू की बहुत याद आ रही है ना, I am going back to Bihar, and my treatment is of 6 months of course, but right now I have just taken 5 month and 5 month treatment only. No, or let's say 5 month 3 week treatment I have taken, and at this time if I ran away and I came to you that I am going to my wife and ran away, then where will you classify me? In which category? You will classify me under treatment completed, because I have almost completed the treatment. Last week medicine you will give it to me and you will say treatment completed, but I don't know whether you are positive or negative. But let's say when I went to Sushant, Sushant said ki, hey bro, hold your sex urges for 1 week, complete the treatment, we will do a final ZLN smear after 6 months and only then you can leave. So let's say Sushant became aggressive and not so Sushant, and it became aggressive and stopped me. And then after 6 months, I went through ZN smear, and when the ZN smear report came, it came positive. So I came dancing to Sushant and said, ki, Dr. Saab, see, positive result has come. Is it a good news or bad news? If positive result came, it means my treatment has been failed. It's a bad news for me. And if negative came, then you will classify me in cured of TB. So remember, lost to follow-up when it is more than 2 months discontinued. If after 6 months, no report, treatment completed. Positive report, failure. Negative report, cured. And less than 4 week treatment are new cases, or no treatment are new cases. So then we can discuss how does TB program function in India. Very simple. After central TB cell, there is a state, then there is district TB unit. But main thing is tubercular unit and DMC. Under one tubercular unit, there is roughly over 3 designated microscopy center. And they have asked this question in NEET 2018, that which of the following is most peripheral unit having facility of microscope? That is designated microscopy center, most peripheral unit with microscopy. There is also one more peripheral unit, drug depot, but it only give ATT. It do not do microscopy. So most peripheral unit with microscopy is DMC. And in plain area, DMC is at 1 lakh, but in hilly area it is at 50,000. Tubercular unit in plain area is at 2.5 lakh, and in hilly area 1.5. In hilly area, population are living far apart. So at lesser population, 1 TU or DMC will be there. Now the question is how to remember it. So one time I was reading Park and I accidentally come into this part that if you are giving the treatment in pediatric cases, and suppose you don't have the color band for that child, so then we give 5 mg per kg isoniazid, 10 mg per kg per day rifampicin, 15 ethambutol, and 25 pyrazinamide. So if you put the same 4 things, 5, 10, 15, 25, and multiply each with 10,000, you will also remember the population norm. Like DMC in plain area, 50,000, 5 into 10,000. So H, R, E, Z. Ideally, it should be 5, 10, 15, 20. But Z is the last alphabet, so we give 5 extra and it is 25. So 5, 10, 15, 25 is the dose. And similarly, 50,000, 1 lakh, 1.5 and 2.5 lakh are the population norm. So with this, you can remember that also. And if they ask where are the 6 national research labs, it's also very simple to remember. The mnemonic is A, B, 3, C, D. So let's say Agra is one center, and Agra had all the Nawab in old times. So suppose Agra Nawab had 3 Begum. First name Begum came from Bhopal, second from Bhubaneswar, third from Bangalore. Guess which Begum Agra Nawab used to love the most? In a money class, the student answered Bangalore only. I don't know why. So Bangalore Begum, because he was loved the most, that is being made National TB Center. And Chennai is National TB Research Center. So these two can be confusing. To avoid the confusion, I used to think that Chennai have all intelligent people eating curd rice and all and doing research. So research is done by Chennai, intelligent people. But credit is taken by the IT hub of our country, Bangalore. So Bangalore take the credit, but research is occurring in Chennai. Suppose like that, we can remember this. Okay. So these are the point in TB program from PSM part, which you have to remember. I can also discuss you test investigations and all, but that is mainly in microbiology. But still, let's have a quick discussion. They can ask this question: what is the best indicator of spread of TB infection? And people write Z and smear or CB-NAT. Remember this point: Z and smear or CB-NAT, it can tell us the disease, but there is difference in TB between infection and disease. Infection, as I said, is in 40% Indian, and infection is detected by tuberculin test and IGRA test only. Only 2 tests detect infection. Now, if we are detecting a spread of TB infection, then infection cannot be detected by Z and smear or CB-NAT. Infection can be detected either by tuberculin or by IGRA. And IGRA is a very costly test, not done mostly in India. So what is the best indicator of spread of TB? We detect it by tuberculin test, and this indicator is known as annual incidence rate or annual risk of TB infection, ARTI. This will tell us best whether TB is spreading in our country rapidly or not. And how do we do it? We catch any 100 Golu-Molu children, do tuberculin test in those 100 children. Suppose out of 100, 30 came positive this year. Again, next year also we will do tuberculin test on those 100 children. And suppose this time 45 came positive. So last year 30 were positive, this time 45 were positive. It means within last 1 year, 15 new cases of tuberculosis occurred. So that is the way of detecting annual risk of TB infection. And if ARTI increase by 1%, 50 new cases of sputum positive TB per lakh population occur. And this is just an observation. 1% ARTI means 50 new cases per lakh population of TB. So remember this, tuberculin tell about spread of TB best. Then they have asked it in NEET 2018 itself, same year, that which test of TB we need to take whole blood sample of patient. So only one test in which whole blood sample is needed, that is IGRA. Whole blood sample is taken in interferon gamma release assay. In rest, we do not take whole blood sample. So these two for infection. After that, which is Z and smear. If they ask best screening test for TB disease or cases, not for infection but for cases, answer will be Z and smear for TB cases. Then fluorescent microscopy is better than Z and smear, but the dye is auramino, rhodamino. CB-NAT is better than fluorescent microscopy, but CB-NAT sometimes over detect atypical mycobacteria also as TB bacilli. Therefore, if they ask what is the gold standard of TB treatment, answer will be liquid culture in liquid medium. That is the gold standard, because liquid medium growth occur quickly and the growth will tell us the characteristic of the colony. So we will not overdiagnose. Gold standard is culture in liquid medium. Best screening test for case is Z and smear. Best screening test for infection is tuberculin. And they can ask in tuberculin, when do we get false negative, false positive? Very easy. False negative for that for which we think we are negative. We think we are negative for HIV. That is the same thing which we get false negative in tuberculin. and we all are positive for BCG vaccination in childhood. So false positive is in what we are positive, tuberculin, history of BCG vaccine. False positive for which we are positive, BCG. False negative for which we are negative, HIV. Like that you can remember tuberculin, false positive, negative also. Okay. So these are the things. Acha, one more thing they can ask about Jaden smear. Remember three things which we add can be remembered by the mnemonic काल. इस काल में हम तुम करें धमाल, है ना. काल is the mnemonic. First we add carbol, fuchsin, then acid alcohol, then lochless methylene blue one by one. And leprosy and TB bacilli have mycolic acid in their cell wall. So this acid do not wash their color. That's why they are known as acid loving, because acid has no effect on them. Okay. So that's all from TB program. Now let's go to read the last big program, malaria program. I know many of you find it very difficult to revise health program. So that's why I first try to make this clear in all of our mind. In National Vector-Borne Disease Control Program, 6 diseases come: malaria, filariasis, dengue, JE, chikungunya, and filariasis. Right? And Kala-Azar. These are the 6 diseases written here. Now, let's say Rekha Mandal became medical officer in charge of, chief medical officer of her city. Where does you come from, Rekha? Please let me know. Suppose she is from Hyderabad. No, Rekha Mandal. Mandal will be most likely from Kolkata, and let's say. Suppose she is from Kolkata and she became chief medical officer of Kolkata, and she is now mayor there. And as a mayor, when she will go, what is the first thing which she should do? Of course, she should give party to friend, but other than party, the first thing which she should do is she should go to the hospital and check the register that out of 100 patients, which disease is coming more commonly. So let's say out of 100, she found that malaria is more common. It means she should focus on malaria first. So this is proportional case rate. Proportional case rate simply means that out of 100 patients, how many had malaria? What does this tell us about? This will tell about morbidity or burden of malaria. कि कितने लोगों ने मलेरिया के चलते खटिया पकड़ ली. This will tell about how many people are suffering from malaria. Burden or morbidity due to malaria is indicated by proportional case rate. Okay. Now, after detecting that, okay, 5 out of 100, let's say, have malaria. That means malaria is of high morbidity, high burden. Now she should detect that, let's say, out of 5 cases, 4 are of Vivax. And Vivax, we all know, cause relapsing fever because they get hidden in the liver, and whenever they come out from liver to blood, a spike of fever occurs. So out of 5, maybe 4 are Vivax case. It means malaria has not occurred in last 1 year mostly, and it is not so much to be worried about. So now we want to know whether malaria is transmitted recently in last year or not. So for that, Rekha Mandal can take blood sample of some of the infant, because infant age is less than 1 year. And if you found malaria parasite in less than 1 year children, it means malaria has transmitted in last 1 year only ना. अगर 1 साल से छोटे बच्चे में मिल गया तो मतलब मलेरिया recently फैला है. If you found it in infant, it is recently transmitted. So this question has been asked. Do you remember recent transmission detected by infant parasite rate? Now, she confirmed that okay, it was recently transferred also. Now she want to know that as compared to last year, malaria is decreasing or not. Because if it is decreasing, she can continue the work. If malaria is not decreasing, she need to do some new intervention. So for that, Rekha can detect that out of 1,000 normal people living in Kolkata in their home, how many are confirmed case of malaria. This is known as annual parasite incidence rate. What is API? That out of 1,000 normal people, how many are confirmed case of malaria. So what do you think, Rekha Mandal? Achha, Rekha Mandal is from Bihar. Wow, very good. You are from United States of Bihar. Okay. So Rekha Mandal, what do you think? In Bihar, out of 1,000 normal people, how many confirmed case of malaria occur? Tell me. Out of 1,000 normal people living in their home, not coming to hospital, how many will develop confirmed case of malaria? That will be API. Let's say Rekha said that 40 case occurred per 1,000 normal population. So that is annual parasite incidence, and do remember the formula. They can give you small numerical on formula also. Confirmed case by population into 1,000. Confirmed case by population into 1,000. Case population 1,000. Okay. So do remember this thing they ask, that if there is more than one case per 1,000, then that area belong to intensive control phase. More than one case per 1,000 if reported. And if you report more than 2 cases, it is high risk area. And if you report more than 5 cases, then you need to distribute insecticide treated net in the whole area. And there are 2 types of insecticide treated net, long lasting and normal. Normal are those who need retreatment after 6 months. Long lasting need retreatment every 3 years. So if Rekha is suppose telling us that there are 40 cases per 1,000, is she reporting too much, or is it a genuine data? Because if it is 40 cases per 1,000, on 1 case we say intensive control phase. On 40 cases, Government of India will shift the headquarter of malaria from Delhi to Patna. So is it correct data 40 or over exaggerated data? What do you think? I think data given by Rekha Mandal is absolutely correct, because if MPW are not making blood smear, then even if 40 cases occur, reporting will be done of only 1 or 2 cases or 0 case. So the final thing which Dr. Rekha should decide or detect is that how many slides are being made per 100 people, and how many slides made from fever case per 100 population. So do remember this point. In API we multiply by 1,000. In ABER we multiply by 100. Why this difference? Because ABER comes in percentage. Minimum ABER should be 10%. Because at least 10% will develop fever during rainy season. So at least their slide smear should definitely be made. If even 10% people slide are not made, it means API is getting underreported. So final thing which Rekha should know is whether people are working or not, whether people are making slide or not, and that is detected by ABER. This was the question in recent UPSC exam, that which indicator will detect efficiency of malaria control program, work is happening or not. That is ABER. Okay, so I hope you will remember the story which we just discussed. What are the 4 steps of the story? First step, she detected that out of 100 cases, how many have malaria, that is burden or morbidity of malaria proportional case rate. Then she detected whether malaria is recently transmitted or not in last year. So recent transmission by infant parasite. Then she detected whether it is decreasing as compared to last year or not. That is why API tells about impact of malaria, whether it is decreasing or not. And last she detected whether people are making slide or not, efficiency of program by ABER. So these are the 4 ways of detecting the burden or spread of malaria, recent transmission by infant parasite rate, and then impact by API also. Now let's talk about malaria control strategy. What is the best strategy for malaria control? Best strategy is don't let the mosquito get birth. Vector control is the best strategy. But they ask a lot of questions from early diagnosis or treatment also. So let's start it with early diagnosis. In early diagnosis, we use RDT kit. And this question has came in NEET last year only, that histidine-rich kit, does it detect falciparum or vivax or both? So histidine-rich kit detect only Plasmodium falciparum. Only one thing. If you have to detect both, you will use optimal kit which has lactate dehydrogenase enzyme. Second point is how do we detect vivax in the smear? We discuss it in the thin smear. There will be dotted granules, and in Plasmodium there will be banana shaped or headphone type gametocyte. Headphone type, 2 things can be seen. Okay. Now Other than that, in the treatment part, they ask a lot of questions from the drug. Do remember, for 𝐍𝐀𝐋 malaria, drug of choice is chloroquine. And we also give primaquine for 14 days because malaria is hidden in the liver. So chloroquine plus primaquine is for 𝐍𝐀𝐋. And for falciparum malaria, we use artesunate or artemether. But do remember one more thing here, that primaquine is something which we can't give in pregnancy, infant, and G6PD deficiency patient. 3 group, we don't give primaquine. Now, when it comes to falciparum, in other states, we give artesunate. But in northeastern states, we give artemether plus lumefantrine. And they have asked it, this tricky question, that what is the dose ratio of artemether lumefantrine? The dose ratio is 1:6. So if artemether is 20 milligram, you will give lumefantrine 120 milligram, 1:6. So why this difference? Because northeastern state, in these state, artesunate resistance is there. So it means artemether can work anywhere in India, but artesunate will not work in northeastern state. So in northeastern, we don't give artesunate, we give artemether lumefantrine, and in other states, we give artesunate combination therapy. Okay? And in artesunate combination therapy, the first day is artesunate sulfadoxine pyrimethamine, second day is artesunate plus primaquine, and third day is artesunate. Giving this treatment is very simple because artesunate dose is 4 mg per kg. So if 60 kg patient come, you simply multiply 60 with 4, which will come roughly 250, and you will write on the prescription ACT kit 250 mg for 3 days. In that kit, all other drug will be according to artesunate. So he will take 3 tablets on first day, artesunate sulfadoxine pyrimethamine, 2 tablets on second day, and 1 tablet of artesunate only on last day. So this is the way of treating, and they can ask this type of question. 2-3 questions come from here. Patient come from Assam to Delhi with Plasmodium falciparum. What is the drug of choice? So if they include the name of northeastern state, answer will definitely become artemether. Now suppose they change the question, and rather than asking Assam to Delhi, they ask Delhi to Assam. If they ask Delhi to Assam, even then the answer will be same, artemether. Because if someone is going from Assam to Delhi, that person might be carrying resistant falciparum from Assam to Delhi, and therefore we give artemether. And if someone is going from Delhi to Assam, then on reaching Assam, he might develop falciparum which is not treated by artesunate. So artemether work everywhere. That's why whenever they put northeastern state name in the option, your answer will be artemether directly. Whether Delhi to Assam or Assam to Delhi, doesn't matter. Second question which recently came in one of the exam is that a pregnant female having 𝐍𝐀𝐋 infection, what should we give? So in 𝐍𝐀𝐋, we cannot give chloroquine plus primaquine in pregnancy because primaquine is contraindicated. So there we can give quinine. Out of these 4, quinine will be the best answer. But in the option, if only chloroquine is also given, that will be the best answer. So if 𝐍𝐀𝐋 in pregnant came, we can give chloroquine as the best answer. If chloroquine is not in option, then we will go to quinine. But we will never go to artesunate. If they ask, pregnant female develop falciparum, answer will be quinine for sure. Because in falciparum, we cannot give artesunate, as artesunate is contraindicated in first trimester of pregnancy. So falciparum, we cannot give artesunate in pregnancy, we will give quinine. My very close friend, Bade Mia Ankur Jain, who is a psychiatry and biochem faculty, he used to tell it that in the first trimester, we should keep pregnant lady as queen. So we will give quinine for falciparum. Okay. Now, let's move to this other part of malaria control, vector control thing. And do remember, what is the best strategy for malaria control? Vector control. For the vector control, in recent exams, they have asked the fish and larvicidal drug name. Do remember, there are 3 larvicidal drugs, Temifos or abate, Temifos, abate, and Paris green. And larvicidal fish is Gambusia guppy. So Paris green is the only insecticide which can kill larva also as well as adult also. If they ask about adult One thing is Paris green, which will be known as stomach poison because they work after going in his stomach. Second is pyrethrum, which is natural. Third are artificial, which is malathion or DDT. So they have asked in NEET already in the past that after how many months will you respray malathion? Answer is 3 months. And after how many months you will respray DDT? Answer is 6 months. So this question came in recent UPSC that which is the insecticide of choice in national program. Insecticide of choice is DDT because DDT need to be sprayed after 6 months. So it will be more costly to spray malathion because malathion every 3 months you need to respray. DDT will be less costly to spray. That's why we use DDT in India, although DDT can cause toxicity after deposition in fat, but we still use it in India. And sometime you must have seen in colony people with fog emitting machine come and sound they make and emit white fog. And many of you used to run in it also. And I used to run it because it used to smell very good. Petrol smell and all. And after I used to come back to my home after running in it, my mother used to smell it also. She also likes sasta nasa. And she also smell it. And then she used to beat me with her comb. And she was correct in beating me because at that time they used to use DDT in space spray. What we should use in space spray or ultra low volume fogging? Pyrethrum or malathion, because malathion is least toxic organophosphate. So they are not, they are, if suppose they came to your colony and did space spray today, after how many days they should come back and do it? They should come back tomorrow to do it because space spray goes in space, it do not have residual effect. So this question has been asked in ICT. Remember, space spray should be done every day. That's why it's not so useful. Last thing is some idiotic question they ask. The PSM people, they are very free. So sometimes they ask what is the diameter of the hole of mosquito net. One hole is 0.047 inch. How many holes are there per square inch? 150. How much more Aedes mosquito can fly? He can fly 100 meters. And up to how much distance there is no breeding zone for airport? That is up to 400 meters. From airport, no breeding zone. For mosquito, not for us. We can breed anywhere. In the aeroplane, above the aeroplane and all. And when I asked in one of the class why there is no breeding zone around airport, one of the students said, sir, because aeroplane will disturb the breeding of mosquito. I said, Rulayega kya pagle, how much caring you are for mosquito sex. And another student said, sir, mosquito will travel to other country without visa. That is the problem. I said, wow. But the main reason is because we want to save ourselves also. Let's say an African citizen landed in Delhi airport with yellow fever and an Aedes mosquito is doing sex there. By seeing African, he bite him and then that yellow fever can be transmitted to me also in Delhi. So we want to protect ourselves also as well as tourists. That's why we don't allow breeding around airport. One more question was under rural malaria control, what is the best strategy? So the best strategy for rural malaria control is intermittent irrigation. Intermittent irrigation simply means in paddy field, wheat field, you might have seen, no, not wheat, rice field, chawal ke kheton mein, dhan ke kheton mein, paddy or rice field. You might have seen they put this much of water. So government say do not put this much of water, put a small amount of water, let it dry for 3-4 days, then again some water, then again some water, so that water will not accumulate and mosquito breeding will be less. So this is intermittent irrigation. Ruk ke sinchai. After some day we will irrigate the land. That is best for rural malaria control. Okay. That's all from malaria. Now we are done with malaria, HIV, TB very quickly in just around 1 hour 15 minutes. We have discussed HIV, TB, malaria, leprosy, school health program, eye program also. Now I want to quickly revise some of the recent programs like the Janani Suraksha Yojana. We know it gives money, but it doesn't only give money. There are 6 things which is done under JSY. So they have asked it one of the exam which is not done under JSY. Which of the following is not included in JSY? First option is Vande Mataram program. In Vande Mataram program, private doctor will put a logo of Vande Mataram and all the things which ASA distribute like iron calcium tablet, OCP, condom, drugs of common disease, they will be given to private doctor to distribute in poor patient. So Vande Mataram is included in JSY. Second thing which is included in JSY is safe abortion services. Third is Village Nutrition Day. And they have asked this question, Village Nutrition Day is celebrated twice a month, once a week, once a month. Answer is once a month. This is known as common language. It is known as Mamta Divas. And guess in which state Mamta Divas is celebrated most? We think in West Bengal because Mamta Banerjee there, but answer is Gujarat. So you can see Modi is celebrating Mamta Divas. There is love in the air. You will come to know about this news very soon. So do remember, Vande Mataram, safe abortion, Village Nutrition Day once a month. Then, after these three things, there is tracking of high-risk pregnancy, and this tracking of high-risk pregnancy is done by Anmol. Anmol is a software which is tablet-based software, and this tablet-based software is given to ANM for tracking of high-risk pregnancy and data reporting. Okay, it is given to ANM, and only in theory, not in reality, but in theory this is given to ANM, this tablet and software for data reporting. Maybe in some developed state it is being occurring, but not in most part of India. So this is the fourth work. Fifth work is money is given to mother and ASA after delivery. And the last thing under JSY is, what is the last thing under JSY? Maternal and child death review, mainly maternal death review. This is known as verbal autopsy. Verbal autopsy means health worker or doctor will go to the home of mother and they will ask a lot of questions like how the mother died, what was the condition in the home, and in-laws are treating her well or not, and they will try to find out the real reason by just asking question. They will do the autopsy of case, okay, just by asking it. So do remember, sixth work of JSY, let me revise it quickly. Vande Mataram, safe abortion services, Village Nutrition Day once a month, maternal death review, maternal tracking by Anmol software, and last, money after delivery. Sixth thing in JSY is done. And JSY come under Suman. Suman has 5 program under it. Suman stand for Surakshit Matritva Aswasan. Aswasan means all is well assurance. And the aim of Suman is that there should be zero denial to maternal health facility in government hospital. They forget to write if available. And under Suman, one is JSY in which money is given. So in NEET they have asked that if a mother developed in urban MP, how much money should be given to mother, how much money to ASA or USHA? To answer such question, you have to remember that there are 10 states of India which are low performing state, 10 states, because they have high maternal and infant death. Those 10 states can be very easily remember. They are Bihar, UP, MP, and then their brother who were separated in year 2000, Jharkhand, Uttarakhand, and Chhattisgarh. 6 easy, Bihar, UP, MP, and then their brothers. Then the 4 can be remembered by the mnemonic Roja. Roja jane man tu hi mera dil. And so R stand for Rajasthan, O for Odisha, J for Jammu and Kashmir, A for Assam. So totally there are 10 states which are low performing, and low performing should get more money than high performing. So first way to remember it is, first remember the money given to ASA is always 600. Whether low performing, high performing doesn't matter. And money given to ASA in urban area, urban ASA is USHA. So sometimes they can write USHA as ASA. Don't get emotional there. So urban area ASA will get 400, rural area she will get 600. 600, 400, you should never dare to forget it. 600, 400. Then in the low performing, mother will get 1400, and half of that 700 will be given in high performing. In urban area low performing, mother will get 1000, half of that is 500, but mother never get less than ASA, so she will get 600 in the urban area of high performing. So how will you remember it? Just remember 4 number: 1400, 700, 1000, 600. And 1400, 700, 1000, 600 for low performing, 1400 and 1000 for high performing, 700 and 600. And Always remember, mother get more than ASA or equal to it, not less than that. And remember, ASA will always get 600, USA will always get 400. So if someone is delivering in urban MP belong to low performing, and then it is in urban means ASA or USA will always get 400, and money given to mother will be 1000. So the answer was 1400. They can repeat it, but they can change it, and they can ask in Kerala, your some mother delivered, and I was about to say your girlfriend delivered. But anyway, let's say your mother some mother delivered in Kerala. So if a lady is delivering in Kerala is high performing. Now you have to see whether rural part or urban part. If they say rural part of Kerala, 700, 600. If they say urban part of Kerala, 600, 400. Like that you can answer. Okay. So this is JSY, and ASA is getting 600 incentive. This is something which differ in different states, but the 600 incentive which ASA is getting, 300 is for ANC, 300 is for accompanying the mother to the hospital. Similarly, the 400 is also divided in two, 200 for ANC and 200 for accompanying the mother. Next program is JSSY, Janani Sishu Suraksha Yojana, and I hope you all know there are 3 benefits which are given under it. One is free ambulance. Second is free treatment and investigations. And third is free food. Ambulance, treatment, investigation, this is not only for mother but also for infant. That's why it is Janani Sishu Suraksha. Janani means mother, Sishu means child. Food is for 3 days if it is normal delivery, and food is for 7 days if it is for C-section. For mother and not for kid. What the kid will eat now. So mother and one attendant will get the food under JSSY. Then there is the most magical program of the world, PMSMA, Pradhan Mantri Surakshit Matritva Abhiyan, Safe Motherhood Mission. So here it is mission, but in Suman it was Aswasan. Here it is Abhiyan, there it was Aswasan. To remember it like this, that as soon as our new government came into power, they started mission to safe motherhood. So Abhiyan or mission started very early. In 2016 only they started this program. But for next 7-8 years, nothing happened. So they changed mission into assurance. They changed Abhiyan into Aswasan. Like that you can remember. Suman is Ashwasan. PMSMA is mission, Abhiyan. So under PSMA, government said that on 9th of every day, free ANC checkup investigation will be done in government hospital. But the magic thing is, if you forget to go on 9th, you can also go on 10th, 11th, 12th, because investigation drugs are free for mother and infant on every day of the month under JSSY. So that's why it is a magical program. It is giving something free on 9th, which is free on every day of the month. But other than that, they say obs-gynae doctor can go there and do voluntary checkup on 9th. And they also classified pregnancy red when it is high risk, blue for high risk with hypertension problem like eclampsia and all, yellow with high risk, those high risk which are due to comorbid condition like diabetes, TB, hypothyroidism, and finally green which are normal female. This is PMSMA. I hope you all know Laksh. Laksh has only one aim, to improve the facility in labor room and maternity delivery ward, maternity OT also. Then there is Dakshata. Dakshata is a Hindi word which means highly skilled. So it is giving training to doctor and nurses to prevent neonatal death and maternal complications. So these 5 programs come under Suman, Dakshata, Laksh, PMSMA, JSY, JSSY. Now, if suppose I am a poor female who don't have any money to go for delivery, which program will help me? JSY, JSSY, PMSMA or Laksh? Please, my friend, do reply to this answer. Dr. SS is asking, sir, PDF of previous session where I get on that Telegram group, my Telegram group, whose link is given on the chat. And we will give the link again. Join that Telegram group, and that is the only place I can give you the PDF. On YouTube, I don't know how to give the PDF, and we cannot give PDF on YouTube. That's the reason. There is a Dr. Immortal Scribe. He's saying that, sir, I have a humble request. Have a concise revision video of PSM. Your channel has great video, but no complete revision video. That's why I am making these 2 videos. One video I did recording on Sunday. That means 3 days back. One today, this video will be of 2.5 hour. If you combine them in 5 hour complete PSM, almost complete PSM revision will be there. So in 5-6 hour, you can do it. This video will be on my YouTube channel, free for all. So I am doing your work, Immortal Scribe, and please keep suggesting me whatever is your demand. I will love to fulfill your demands. Okay, your wish is my command. Now come to read about one more program, Pradhan Mantri Matru Vandana Yojana, Mother Worship Program. Under this, previously government was giving 5,000, but now they are giving 6,000 rupees. 2,000 at 12 week of pregnancy, 2,000 at 6 months when mother comes for delivery, and 2,000 at 6 week vaccination time. This program logo, if you see, will have incomplete mother and child, because this program itself is also incomplete and it has not implemented in any state. Money is not given before delivery, mostly it is given after delivery. So this is an incomplete program, but do remember Pradhan Mantri Matru Vandana Yojana is the logo. So now we will read about Poshan. In Poshan, first thing is, they can ask the full form, Pradhan Mantri Overarching Scheme for Holistic Nutrition. So it is POSHN, which is there, the full form. Then under Poshan also 5 programs come: Anemia Mukt Bharat, Adolescent Program, Nikshay Poshan, PM Poshan, and Anganwadi Program. And all this program, this Poshan Abhiyan, it also comes under Ministry of Education now. So previously it was under different ministry, now under education. And this Anganwadi program, it come under ICDS, Integrated Child Development Scheme. Okay. So let's revise this program, but before that, do revise the target. The target is, we have to reduce low birth weight by 2%, low birth weight, stunting by 2%, and undernourished, underweight by 2%. So stunting, low birth weight, and underweight, undernourished, these 3 should be reduced by 2%. So they can ask, which is not a target of Poshan? Poshan Abhiyan do not focus on wasting. Don't include wasting. Wasting, we have discussed in last session also. Wasting is low weight for height. And low weight for height indicate acute malnutrition. That means if someone is suffering from loose motion or diarrhea for 1 month, he may become thin, although the height is good, and that is wasting. So wasting is not included in Poshan, and the target is 2%. Same question has been asked already for Anemia Mukt Bharat. What is the target? The target is reduction of anemia each year by 3%. 3% anemia, 2% in Poshan. And they have asked this question in a different way, that in Global Hunger Index, which is not included. So Global Hunger Index, we have discussed it in yesterday revision session also, not yesterday, on Sunday revision session also, that Global Hunger Index don't include infant mortality rate, and IMR is also not included in Sustainable Development Goal. Sustainable Development Goal has 70, 25, 12 targets, 70 for MMR, 25 for under 5, and 12 for neonatal mortality. So what are the target in Global Hunger Index? Low birth weight is not a target of Global Hunger Index. Global Hunger Index focus on wasting. Then Global Hunger Index second target is stunting. Third target is undernourished population. And fourth target is under 5 mortality. So Global Hunger Index has 4 targets. I hope you will remember it. Now, as I said, Poshan come under Education Ministry. And what is PM Poshan? PM Poshan was previously known as midday meal. Now they have changed the name and they said we will also give food to preschool children. So new thing in PM Poshan is preschool children added. Now how much protein, how much calorie they give? They give half of protein and 1/3 of calorie, because in most part of India, mother and children are eating only rice. So they can get calorie from there, but they are not getting protein in their home. So they will give more protein, less calorie. Protein is half, calorie is 1/3. Okay. Now this question, Nikshay Poshan. Nik means no, and Chay means loss of body. So no loss of body, and we all know TB have loss of body. So whenever they say 𝐁𝐄𝐄𝐓, SHAY, that is loss of body. And if they say 𝐁𝐈𝐎 is UPT kit delivered by ASA. So that is 𝐁𝐈𝐎 UPT kit, which is separate. 𝐁𝐈𝐎 is for TB, reporting and follow-up by private and government doctor both. But if they say 𝐁𝐈𝐎 portion, in this we are giving 500 rupees per month to TB patient for nutritious food. So if you divide 500 with 30, it will come only 17-18 rupees per day. So government is giving 18 rupees per day to TB patient and saying ki ja Simran, ji le apni zindagi, go live your life in 18 rupees per day. So do remember it, 500 rupees per month being asked also. Now let's come to Anemia Mukt Bharat. As I said, the target is 3%, but they will ask that in the 6x6x6 strategy, which is not included. So first 6 is for beneficiary, second 6 is for the work which we will do, intervention, and last 6 is the institutional mechanism. So you have to remember BII, 6x6x6. Beneficiary, intervention, institutional mechanism. Now, these are the 6 beneficiary. The first intervention is, of course, iron folic acid tablet. If you are giving it in less than 5 years, iron should be 20 milligram and folic acid should be 100. How will you remember? Very simple. 20 multiplied by 5 will be 100. So up to 5 years, iron 20, folic acid is 100 microgram. Microgram is also written as mcg. So will you give a high dose in children or low dose? Low dose. And to make the low dose, will you give it once a week or divide it into 2 doses a week? So if you divide it, it will become low dose. That's why only in one group, in children, we give it twice a week. Only in children, we divide it and give it twice a week. Then there is pink color, 5 to 9 year, for our cute little pink children of 5 to 9 year, which are getting 45 milligram iron and 400 microgram folic acid once a week. Then the blue color is for adolescent. Mostly in this age, they watch blue film and also blue adolescent and there. And 60 milligram iron, 500 microgram folic acid. This question came in INICT already once a week. Then there is red color for adult female, in which we give the same dose as adolescent, and also once a week in adult female. So to remember it together, the mnemonic is PBR, like PVR. And we used to go to watch movie in PVR, and some people also go there to do some other work. So in PVR, movie is released once a week or twice a week? Movie is released once a week in PVR. So the same way, pink, blue, red, PBR is given once a week. But if the same red tablet is given in pregnant female, in pregnant we cannot give once a week, so there we give once a day. Same dose, but once a day in pregnancy and lactation, 180 day before and 180 day after delivery. Okay, this is the first intervention. The second intervention is albendazole tablet. And if albendazole tablet is given in less than 2 years, we give half dose 200 milligram. If it is given in more than 2 years, we give full dose 400 milligram. Okay. Now, albendazole for prevention is given only twice in a year. So, but when we are treating the patient for worm infestation, then we give it 1 tablet today, second tablet after 14 days. So, in the deworming work, the first tablet is given on 10th of February. That is National Deworming Day, and second is on 10th of August. So if you met your girl or your boy 4 days before Valentine's Day, you will give that 1 tablet of albendazole in their mouth. And your boyfriend or girlfriend will ask you, hey, why are you putting tablet in my mouth? What do you intend to do? Kya karne wale ho goli khila ke? So you will say, ki this tablet I am giving to kill all your worms, तुम्हारे कीड़े मारने के लिए दे रही हूं. And what comes on 10th of Feb in Valentine week? है ना? Is it hug day? It's teddy day which comes there. So on teddy day, we will put albendazole tablet in mouth of our teddies. Second is 10th August, 5 days before independence. So these are the 2 benefits. The third is BCC. BCC means behavior change communication. You will say to the child that if you eat iron tablet, you will be able to hit all the children of your colony. They will take it solid body. And you will say to the mother that, mother, if you will eat it, your child will come first in the class. He will have a smart mind. So then the mother will tell it. So this logo of program solid body, smart mind, can be used to change the behavior of people. That's why it is BCC. Fourth benefit is digital hemoglobin measurement. Fifth benefit is fortification of food with iron folic acid. And sixth benefit is focus on other cause of anemia as well, like malaria, thalassemia and all, not only nutritional deficiency, iron deficiency anemia. How will you remember the sixth thing? First two, I think you already remember, IFA plus albendazole. This is very simple. Main thing is to remember the last four work. First is BCC. I think this is also clear. Then we focus on fortification of food, food fortification, fortification of food, and then focus on other cause also. So triple F other. Focus on other, not girl or boy, but other cause, and food fortification, and a triple FO. And then there is digital HB measurement. They have already asked the question from the intervention. They can ask which of the following is not an intervention of Anemia Mukt Bharat. So do remember the 6 interventions which are there. After that, we can revise Ayushman Bharat very quickly. Do remember one very important thing which we have already discussed. A school health program also come under Ayushman Bharat. Along with that, there is Health and Wellness Center and PMJ, Jai Ho PM Ki. So if you see the logo of this program, in the logo there will be a green pot with 5 leaves. The same 5 leaves which also occur in marijuana plant. So what the government is asking you to do? Himal Phuko, smoke marijuana? No. They are giving you 5 petal photo to make you remember that in PMJ, the insurance is of 5 lakh rupees. So 5 lakh in health insurance. Second thing they can ask is it for BPL category or economically weaker section? So PMJ is for economically weaker section, not for BPL patient. BPL patient has been given Rashtriya Swasthya Bima Yojana, which was old program by Congress government. PMJ 5 lakh for EWS. In private or government or both? In both private and government, secondary and tertiary level hospital, it is but this insurance card can be used only after patient is hospitalized on the bed. Only then this card can be used. Okay. So this is there. Second question which has asked from this point is Ayushman centrally funded, government funded, state government funded, centrally funded, or both? So Ayushman Bharat, similarly Food Safety Standard Authority of India, FSSAI, both of these two things, they are state and central government, both fund them. Central government gave around 60-70% fund in Ayushman Bharat, and state government gave around 30 to 40% fund. Okay, so first thing is PMJ insurance, which we discussed, 5 lakh for EWS. Second is Health and Wellness Center. Government is saying we will replace the PHC and sub center into Health and Wellness Center, and with replacing it, we will give 6 extra benefit: mental health, dental health, mental, dental, then ENT facility, opthal facility. Geriatric health is still given under NCD, NPCDS program. We have read that 1 day per week separate OPD for NCD at PHC. So this is given, but still they said we will give it again. Trauma or emergency care is still given, but they will say they will give it. And then they will add palliative care, which is not even at medical college many a time. For cancer patient, pain relief care they will give. And final thing they said is we will give yoga, because yoga will take care of all the things. So these are the new facility which government is planning to give under Health and Wellness Center. So this is Ayushman Bharat. After that, we should remember this very important and very typical question, that which is not a priority of NSSK. NSSK stand for Navjat Sishu Suraksha Karyakram, and Navjat means neonate. So do remember this, that NSSK has 4 targets. First, to prevent the child from infection. Second, from hypothermia. If they are able to prevent the child from infection, hypothermia, they will do breastfeeding. If they are not able to save the child from infection and hypothermia, they will do neonatal resuscitation. So like a story, you can remember the 4 things. First, we will prevent from hypothermia and infection. If prevented, we will do breastfeeding till 6 months, exclusive breastfeeding. If not, we will do resuscitation. So these are the 4 things: infection prevention, early breastfeeding, prevention of hypothermia, neonatal resuscitation. But maternity ward facility is improved under Lakshya program, not under NSSK. Do remember this 4 work of NSSK, they have already asked it. Now, next is RBSK, Rashtriya Bal Swasthya Karyakram. How do you take care of your bal? Tel laga ke? By putting oil? No. Bal means not hair. Bal means children. And for children, there is a screening program RBSK in which we screen for 4D, disease of childhood, developmental anomaly disability, defect since birth, and deficiency disease. So, who does the screening? Ayush doctor does the screening in government school, Anganwadi worker do the screening in Anganwadi, and ASA worker do the screening by home visit. So, all 3 people work under RBSK. The question which they ask from here is, which of the following disease do not come under RBSK? So, in RBSK, Ayush doctor is going with a stethoscope only. So, if any disease need a instrument for detection, it will not come under RBSK. So, out of these 4, congenital glaucoma can only be detected by using a goniometer or optic nerve thickness measurement. So, glaucoma do not come under RBSK, but retinopathy of prematurity in which eye bulges out, it comes under it. Congenital cataract also come under it, and congenital heart wall defect also come under it. Government expect that Ayush doctor will find the heart wall defect with a stethoscope. So these all come, but glaucoma do not come. Similarly, they have asked, which of the following diseases do not come under RBSK? Is it vitamin A deficiency, zinc deficiency, iron, or vitamin D? So zinc deficiency is very difficult to find from naked eye. I have seen more than 10,000 patients for sure while working at my PHC postings and CHC postings at AIIMS New Delhi, but never diagnose anyone with zinc deficiency. Have you ever diagnosed anyone with zinc deficiency? Please let me know. But other diagnoses, vitamin A, iron, and vitamin D can be made easily. So zinc deficiency do not come under it, and we have discussed it yesterday also in last session also. The dryness around nose and mouth is a symptom of zinc deficiency. Plus zinc deficiency also lead to hypogonadism. है ना, टट्टा छोटा होगा, small testicles. It can also lead to delayed wound healing, and along with delayed wound healing, there can also be abortion or stillbirth if zinc deficiency is there, which can lead to acrodermatitis enteropathica. Now they can ask a tricky question from you, and they have already asked this question, that a 12-year-old girl is malnourished. Listen this carefully. Huh? She is not going to school. Which following program will help us? RBSK, ICDS, NSSK, or a school health program? So if she is not going to school, school health program can never help us, never help her. NSSK is for neonates, it will also not help her. If they write midday meal, that will also not help her. If they write PM Poshan is same as midday meal, it will also not help her. So which program will help her? Answer is ICDS. Why ICDS? Why not RBSK? In RBSK, we are doing screening, and she is already detected as malnourished. So she do not need screening, she need food. In RBSK, we can also treat some simple illness, but malnourished cannot be treated by drugs. Malnourished need proper nutrition for treatment, and nutrition will be given in Anganwadi under ICDS program. So if you find malnourished word written in the question, answer is ICDS. If they remove malnourished and only say that 12-year girl is there and she is not going to school, which program will help her, then RBSK can be the correct answer. But if they have written the diagnosis, that is malnutrition, answer will be ICDS. Okay. Then there is also one program for adolescent, RKSK, in which we have adolescent friendly health clinic, separate OPD for adolescent, and we have adolescent reproductive and sexual health, in which adolescent girl of the village will form a group, and they will hold monthly meeting with panchayat and female school teacher. When they meet with panchayat, they will raise their demand, and when they will meet with female school teacher, it is expected that female school teacher will give them sex education. And if they are unable to give sex education, they will talk about menstrual hygiene or safe disposal of sanitary pad. So remember, ARS, Adolescent Reproductive and Sexual Health, and AFHC, Adolescent Friendly Health Clinic, come under RKSK, Rashtriya Kishor Swasthya Karyakram. Okay, so these are the program which I needed to discuss here. Now we can go to other topics like entomology or biostat and occupational health. So if you want to discuss any of this topic, do let me know. One more thing we can discuss is some of the logos and all of confusing program. Like Niti Aayog logo is simple, but they ask the full form. It is National Institute for Transforming India. And which organization it replaced? It replaced National Planning Commission, because in the Planning Commission was there in India since 50 to 2013, and it has all the corrupt people of Congress in it. So when BJP government came in 2014, it say, oh, all you corrupt people of Congress, go away. Now our corrupt people will work. And they replaced Planning Commission with Niti Aayog. Okay, so do remember the full form. And then 𝐐𝐂 we have already discussed. This is the reporting program for TB. It has been asked recently also. And you can report the patient on mobile app also. That is under it. Okay. 99 dots is also a TB reporting program. Actually, in 99 dots, patient has to give a missed call on a secret number which is behind the wrapper. So if they will give the missed call, government will know that they are taking the drug. And if they are not giving missed call, then ASA will go to their house and ask, hey, why are you not giving missed call? So the patient can say that I'm not eating drug, that's why I'm not giving missed call. And therefore ASA can ensure that compliance is there. So 99 dots will increase compliance to dots. Okay. Chalo. Now, there are 6 programs in which mother and child are there in the logo. If it is green color mother, green color child, that is Anmol, which we developed, is for discussed with for A&M reporting. If it is mother and child separately, playing and all, this is Kilkari, not Pichkari, Kilkari. Kilkari is the first child cry. This is recorded messages on child care, which is given on mother phone. Okay. Then let's revise the other program with mother and child together. Kilkari was one. If it is yellow color mother, yellow color child, that is JSSY or JSSK. Janani Sishu Suraksha. Sishu means infant, and Sishu, infant, keep on doing Susu. So due to Susu, this is yellow. You can remember like that. So yellow color mother's child as JSSY or JSSK, same thing. If it is incomplete mother and child, we have already discussed, this is Pradhan Mantri Matru Vandana Yojana, under which 6,000 rupees is given, because this program is incomplete, so the logo is incomplete. If it is black color mother child, it is Laksh. If it is white color mother child means foreigner program, BFHI. And if it is blue color mother child is for UNICEF. So these are the 6 mother child logo. I have recorded an Instagram reel on that also. I will forward it to the Telegram group and to people. Now, I hope this 6 mother child logo is clear to you. Then you should know some more program. One is Mobile Academy, in which ASA is get training on phone. Then Kilkari we have discussed. What is the difference in Indradhanush scheme and mission? Indradhanush scheme is talking about 7 days, 7 different color bedsheet in government hospital. Okay, not in Dr. Ajit bedroom, but in government hospital. And what is Indradhanush mission? That was for vaccination by 7 disease, DPT, measles, and 3 disease which is given at birth, OPV, Hep B, BCG, for which ASA do not get paid. These 3 vaccine given at hospital, so ASA don't get paid for it. So previously this program was for 7 disease, now it is including all the vaccines. That's why now it is known as Intensified Mission Indradhanush 5.0. Then sometimes they ask about Ujjwala, Ujjavala, and the student get confused in it. There is no point of confusion if you focus like this, that Ujjavala have jaw written in it. And what is the function of jaw? Jaw will grind the food, prevent it from falling out, and take it to the stomach. So similarly, Ujjavala have a jaw, and it will prevent child trafficking and help in their rehabilitation. But Ujjwala is the one whose logo you can see on the petrol pump, that is free LPG cylinder for BPL with one-time gas in it. So Ujjwala is for gas, Ujjavala prevent child trafficking, help in their rehabilitation. Ujjala is only LED light promotion by government, never being asked. Okay, PM Poshan and all we have already read. So now we can move to our next thing. But before moving there, I want to revise you one very important thing, that is step surveillance. A lot of questions are coming from it. Step surveillance is, let's say you want to compare that whether India has more high risk population for diabetes or Uganda. Uganda is a real country name. And don't look at me and say Uganda. Okay. Now, this step surveillance, what we do is, if we want to compare India with Uganda, We will take 5,000 people from India, 5,000 from Uganda, and we will ask them some 3 level of question. So it is to know high risk population. It is to compare high risk population. We do step surveillance. And in this step surveillance, the first level of question is psychological or behavioral, in which we ask about alcohol, smoking, diet, exercise. Second level of question is physical factor, in which we ask BP, age, and BMI. Third is biological factor or hormonal factor, in which we include RBS, thyroid profile, lipid profile, 3 things. So the question they have asked from here is that which factor is not included in step surveillance? This was NEET question, 19 or 20 they have asked it, that which factor is not included in step surveillance. So we include biological, behavioral, therapeutic is not included, because therapeutic is to start treatment, and we are not focusing here on starting treatment. We are just focusing on comparing that which country has more high risk people for diabetes and all. So therapeutic factor is not included. Second thing they have asked, how will you remember all the factors which are included? To remember all the factors which are included, you can use the mnemonic bum pe haath. Haath means hand, pe means on, and also, or you can use the mnemonic benign paroxysmal hyperplasia of prostate also, BPH, and a bum pe haath. There are 2 bum on which we have placed 2 haath. There are like 2 bum pe haath. First B, as I said, is biological. Second B is behavioral. 2P are physical and psychological, and H stand for hormonal. So this is the factors which are there. Then sometime they ask, which test is not included in step surveillance? This is the question which is expected in NEET exam. Which test not included in step surveillance? So the test not included, for that we have to know which tests are included. And for that, a student gave me a very good mnemonic, BTR love. How to remember it? All the tests. BTR love is the mnemonic for that. Student gave me, I don't know why. First B is BP and BMI. 2 things. BP, BMI. Then T stand for thyroid profile. Okay. R stand for, what is the R? R stand for RBS. And L stand for lipid profile. So with BTRL, you can remember all the tests done under it. Okay. And as you can see, we have already discussed NEET Aayog. Manoranjan is asking, what is 6 into 6 into 6 in Anemia Mukt Bharat? Manoranjan, we have discussed this already. First 6 is the beneficiary who will get the benefit. Second 6 are the intervention, the work which we will do. And last 6 is the institutional mechanism, the way by which we will give those things. Okay, so beneficiary, intervention, institutional mechanism are 6 into 6 into 6. Dr. Ajit Das has questioned that I have scored 200 plus marks in GT, lost my interest in studying, 5-year repeated. Should I resume to job and left out PG hope? In post MBBS days, I left seat of anesthesia, ENT, but then I joined residency for wellness of my family. Then my study goes suppressed. Simultaneously, I was suffering from breakup, then got married last year. Ajit, you are discussing a very personal problem here, and I cannot advise you just by listening 1 minute talk. We need to talk more on it. And if anybody of you need to talk more with me, you want to discuss your personal or family or financial problem, you can always call me, and I will listen to you first. And I have seen that by listening to you, mostly your heart knows the answer. You know the solution also, but when I listen to you properly, then those solutions come out and I can guide which one is better. For you, Ajit, I will suggest that don't leave the hope for PG exam. If there is, let's say, 4 days left, 5 days left, in last 4 days, I would suggest you that revise 6 years of NEET exam, NEET PYQ with topics. What are the topics? And you will find with just 6 revision, you can get very good score. Plus, if you have worked for 5 years already, your experience will also come back in your mind when you are working on question in the exam. And don't worry, you can score really good. In last 4 days also, just focus on PYQ and do that. If you have done the NEET exam PYQ already, I will request all of you to do INI-CT also, because the question in NEET are being taken many a time from INI-CT also. They are not two completely different exam. They do change their question. and then read the recent FMG question also, which has been came in FMG exam. Those are also important. Many a time NEET do copy question of FMG exams. So recent FMG, INICT and 6th year of NEET, if you will do in 4 days, I'm sure you will get out with a very good rank, which is there. Okay, and don't lose hope, dear. Do talk to me. You know, I hope I can help you there, especially with the breakup issue. I can help you there. I myself has also suffered from anxiety, depression and all during my internship time and after a breakup, so I can help you there. Now come, junior surgeon is saying कि क्या पढ़ाते हो सर, एक ही तो दिल है कितनी बार जीतोगे. Junior surgeon, I am feeling like kissing you. Thank you for appreciating it. And now let's move ahead. Yes, and junior surgeon is also giving an advice that life give you chances again and again. Don't get disheartened. Just wait for the moment to bounce back. Very good, junior surgeon. Good advice. And now wait, keep working on yourself and things will be good. Now, one good question is, they have asked that in the life cycle of hydatid cyst, where will you find the adult form? So the sign of adult is adult do sex. So the sexual part of the life cycle is in dog. Therefore, adult form is also in dog in hydatid cyst. And there are 3 illnesses in which man is the intermediate host. One is hydatid cyst, one is toxoplasmosis, and other is malaria. In this 3 disease, sexual cycle of parasite do not occur in male. In these 3, man is intermediate. Man had asexual life cycle of these 3 diseases. So who are the main host? Who are the adult form in these 3 diseases? In the adult form of parasite of hydatid cyst, we discussed already, is in dog. In toxoplasmosis, it is in cat. In malaria, it is in mosquito, Anopheles mosquito, female Anopheles mosquito. So adult form or main host in these 3 diseases is not human. Now, there is 2 point written that if suppose in the family of TB patient, a less than 5-year-old child live. So to that less than 5-year-old child, there is risk of TB. We give isoniazid prophylaxis therapy at any CD4 count. We don't do CD4 count and all, and we start giving isoniazid prophylaxis therapy to all the contact of TB patient, as well as we also give it in HIV patient. If they do not have TB, we prevent them TB by giving isoniazid prophylaxis therapy. But when we are giving cotrimoxazole preventive therapy, then CD4 count must be less than 350. Okay, because after less than 350 only, mostly those opportunistic fungal infection will occur. Okay. Now they can give you the image of life cycle of leptospirosis, in which there will be rat urine. You can easily identify it. And in the life cycle of JE, they can ask who is the reservoir. Reservoir or maintenance host is the same thing. They store the virus when it is non-rainy season. And in non-rainy season, it is stored in ardid bird or heroine, bagula. Then in the story entered our nuisance mosquito Culex. And Culex is so talented कि ये उड़ती चिड़ैया के बम में काट लेता है. It bite in the bum of flying bird. And then from there, it bite in the bum of suarva. It bite in bum of pig. And from there, through trans-ovarian transmission, from the pig, it takes the Culex JE virus and the Culex inject it in human. But if a Culex bite me and then bite, let's say, my friend Nikhil, who is with me in this class, helping in arranging it and all. So then JE cannot go from me to Nikhil. That's why human are dead in host. Infection cannot go from one person to another just by Culex bite. And we need to, Culex need to bite a fresh pig, then only it can transmit us. Okay, so man is dead in host, maintenance host or reservoir is ardid bird heroine, and pig is amplifier. When I was in MBPS, I used to think that pig must be singing this song for JE virus, कि मैं तेरा amplifier है ना? So pig is the amplifier, do remember. So that's all from all the programs, all the images. In 2 hours, we have done it all, and I'm sure this will really help you. Now, we can move ahead and we can discuss some of the topics of this biostats. In biostats, a lot of confusion occur when it comes to null hypothesis, alpha, beta error, and p-value. But remember, my friend, it's very simple concept. Null hypothesis simply means that in the beginning, researcher said my drug is null is lull. There is no difference between my drug and previous drug. And if any difference come, it is just due to random factor or by chance. That is null hypothesis. Null means my drug is null, lull, useless. That's the first thing. Now, Dr. Ajit Raj is writing that, okay, I will do all PYQ again this time. Yes, Ajit, love you. And you have seen the life, bro. You are very experienced and you must be confident also. Just continue the path. Okay. Now, after giving null hypothesis, after saying that drug is not useful, then in the second step, we pre-decide mistakes or error which we are going to do in the study. And no matter whether it's a study or your life, we will do some mistake. So there are two types of mistakes which we do in study or in life. One is alpha error, other is beta error. Alpha error is when we think we are better than everyone in the world. When we overestimate ourselves or our drug, that is alpha error, type 1 error. Alpha error simply means false positive. Do remember this word. False positive is alpha error. Alpha error means saying non-significant or useless medicine as significant. And a very good example of this is coronal drug trial done by researchers of Baba Ramdev. Baba Ramdev, when he did the research of coronal, the researcher has written in the report that all the participants were asymptomatic. Asymptomatic means they had no fever. And then at the end of the research, the researcher said, coronal can treat corona fever. How, man? If all patients were without fever, then how can you say that it can treat fever? It means they were giving false positive report for coronal drug. They were saying non-significant coronal drug as significant. That is alpha error, type 1 error. And beta error or type 2 error is acting foolishly, false negative. It's saying significant as non-significant. Let me give you a very good example which can make this alpha beta error forever clear in your mind. Let's say a boy proposed a girl and the girl said, you are not significantly different than my other friend. I have not seen you from that angle. So what the girl gave to the guy? The girl gave null hypothesis to the guy. Then will the guy accept it or will he try to reject it? He will try to reject it. So like that, researcher will always want to reject null hypothesis and show the other angle. So the guy will say, what about all those chat which we used to do on phone? So the girl will show that this chat is just randomly done. It is by chance. I do this chat with other also. You took it seriously. So this is null hypothesis which saying you are not different than other friend. Any difference which came is just by chance. So now the boy, suppose he want to prove that I am different and he thought I should propose in a better way. And he's come back to the hostel and anyone who is coming from date, this boy is taking the history what happened in the date. So let's say first a alpha male type of senior went into date, but when he went into date, he was unable to express, so he just came back. And now a junior is asking what happened in the date. So what the senior will say? I am your father, you don't know. We did this and that also. So what this alpha male type senior will do? He will say non-significant date as significant. He will give false positive report for date. He will overestimate the date. That is alpha error. And now suppose a batchmate is coming from date. And when this batchmate went on date, he took the courage and expressed herself and said that I like your nature, smile, company. And the girl said, why you didn't said it to me 3 years back? I was waiting for it so long. And the girl gave a kiss to the guy. And this time the date is significant. Everything happened well. But he is coming back and batchmate is asking what happened in the date. If he will say the correct thing that I got a kiss and all, first this batchmate will ask for party. And then whenever they will see the girl in the campus, they will shout, Bhabhi, Bhabhi, hai na? My brother's wife and all, they will shout and their love story can end before starting. So the batchmate will not tell the truth. He will underestimate the date. He will say, no, nothing happened. You know how shy I am. So this type of result where we underestimate ourselves or our date, where we act foolishly, that is beta error. And here he is giving a false negative report to the date. The date was not negative. Date was actually positive with a kiss on cheek, but he saying that it was false forcefully. So saying significant date as non-significant is beta error. I hope you will not confuse. And why this I emphasize so much on it with example, because later on we will read about p-value, and p-value is same as alpha error in meaning. So if you understand alpha error well, you can do a lot of question on p-value correct. Alpha error also means false positive. P-value also means false positive. We will come to that. So the second step is we will pre-decide the mistake. Usually alpha error pre-decided is 5%, beta error pre-decided is 20%. After deciding the mistakes, we conduct a study which can be RCT, cohort, case control, anything. When we will conduct the study, data will come from that. We will put the data in the computer and we will give the command to computer, apply chi-square, paired, unpaired, all those things we will apply by computer. Computer will apply the test and the result will come in p-value, confidence interval, and mean relative risk. Now, with the by using these three things, we will decide whether my drug was significant or not. So the main thing is p-value. What is p-value? Definition wise, p-value means probability of getting significant result by chance or by mistake. And why I said p-value is same as alpha error? Because in coronal study, alpha error was happening. And what was happening in coronal research? Baba Ramdev was getting significant result. But Baba Ramdev and their researcher was getting significant result by chance or by mistake. Na? So that is p-value, that is alpha error. Probability of significant result by chance, by mistake. Okay. So this is there. Now, Nikhil, to put the charger. Now, if the p-value is less than or equal to 0.05, less than or equal to 0.05, it means p-value is very less. Mistake done in study is very less. C type chahiye. Okay. Sorry for this interference. Let me repeat this p-value thing. If it is not clear, you can get a lot of question wrong. So understand it properly. I still remember on my first day of counseling in Aligarh Muslim University in MBBS, there was a girl who looked at me, and her name was Monica. And just with her one look, I felt like butterflies flying in my stomach, and the whole day I was happy and all. But when I went back to my room, I came to know my other room partner are also having the same feeling. And they also thought it was significant. But actually, Monica's look was just by chance, and we took it significant. So what was happening there? We were getting a significant result, but actually the look was by chance. So that means we were doing a mistake on that day. And any mistake should be done less, minimum. Mistakes should be less. So if p-value is less than 5%, if mistake is less than or equal to 0.05, it means mistake is almost negligible, very less. So a study is worth trusting. We will consider the study significant if mistake is less than 5% or equal to 5%. And we will think that drug is significant, useful, because very less mistake is done there. And if we say that drug is significant, we will reject the null hypothesis. So remember this point, whenever p-value is less than or equal to 0.05, the result is significant, null hypothesis rejected. And p-value also mean false positive. Okay, like on that day, with my batchmate look, I was getting positive vibe, but it was false positive vibe because it was just coming by chance. Okay. Now, do remember one more small thing on which they ask a lot of question in NEET and INICET both. They sometimes give you confidence interval in terms of relative risk or odds ratio. And if you found 1 in the range of confidence interval, if 1 is in the range, it means that is not significant study. Like 0.8 to 1.3, if they say, then between 0.8 and 1.3, 1 will lie. And we all know if relative risk is equal to 1, relative risk equal to 1 means no association. So if you found 1 in the range, it is non-significant study. There is no association which is there. Okay. So 1 should not be there. Now, let's do some objective question here. If they say p-value is 0.023, which option is correct? P-value is 0.023 means less than 0.05 or equal to it. If it is, it means 2.3% mistake, very less mistake. So if this much less mistake is done, study is significant. And if study is significant, we will reject null hypothesis. But if the p-value is 0.23, 0.23 means 23% mistake, and 23 mistake means we will not consider study significant, study is non-significant, and whenever study is non-significant, it means null hypothesis was correct, we will accept it. Okay, so they can ask this question one way. Second thing they can ask is, if p-value is 0.05, 0.05 means significant. Researcher is saying that study is significant, but in reality drug is not significant than other drug. So which type of mistake is happening here? Researcher saying my drug is useful, like coronal study, saying my coronal can treat fever, but in reality all the participants were without fever, so coronal is not different than other drug in treating fever. So in reality it was not different, but forcefully said it is significant. That is alpha error or type 1 error. So the mistake done here is type 1 error, alpha error. Now what is 1 minus alpha, 1 minus beta error? 1 minus alpha error is confidence of study. And like if I ask how much confidence you have on your friend, so it all depends कि आपका दोस्त फेंकता कितना है. It all depends how much lie your friend tell. If your friend lie a lot, alpha error is a lot, confidence will be less. Okay, so confidence means ability to trust, it is 1 minus alpha, and power means 1 minus beta. If I say, will you be able to qualify NEET exam under some 20,000 rank this time? All of you should say yes. But some of you will say yes, some of you will not say yes. Those who will say yes, they are not underestimating themselves. Their beta error is less. And because beta error is less, they have more power. They can say that, yes, I will come under 20,000. So stop underestimating yourself, stop doing beta error, and your power will increase. Power means ability to say significant as significant. And you all can come under 20,000, but those who will stop underestimating themselves, they can say it, because their beta error less, so power will be more. And if you want to increase power and confidence both, then we need to increase sample size and association. Let me give you an example. Suppose my friend Dr. Saine Medico took radiology, and he has found a new drug which can, if given intravenously, can remove the blockage of myocardial infarction. So he gave this drug to 2,000 people with heart attack, and all of them recovered. Will you trust on him? Will you have confidence power on his drug? Yes, because sample size is more. And now suppose all the patients who took it, they recovered from heart attack within 1 hour. It means the association is also very strong. So if the association and sample size is strong, we will trust that the drug is having more power and confidence. Okay, so do remember this formula and it. Now let's practice some more question on this topic, because p-value questions need practice. A study is significant if, when will you call a study significant? First thing is p-value should be less than equal to 0.05. So C and D can never be connected. If it is more than 0.05, study is not significant. But along with less than 0.05, results should not come by chance, because whatever come by chance can be by mistake. Like the look of my batchmate Monica, it was just by chance. So we will not trust those things which are by chance. We will say those things as significant which are occurring again and again, again and again, again and again. Yeah. If it is occurring again and again, if someone is looking at you again and again 500 times, then it is not by chance, unlikely by chance, and then you will call that look or that study as significant, because it is not happening by chance. Okay. Last thing is, if p-value is 0.04, what does it mean? It means, it doesn't mean that significant 4%, non-significant 96%, or non-significant 4, significant 96. No, p-value do not talks about significant, non-significant thing directly. It only say that if it is 0.04, result came significant by chance 4% time. It is significant by mistake 4% time. That's what p-value said, that how many times it was significant by chance. Okay, and do remember, p-value always means false positive. I hope this topic is clear to all of you. Now, we are done with it, with this part of biostat. But there is one more small thing, parametric, non-parametric test, which we usually do not revise, so do revise. Whenever they want to know the relationship, if the relationship word is given, relationship can only be known by correlation. And parametric, P for parametric, P for Pearson. Parametric will have Pearson correlation. Non-parametric will have Spearman correlation. Okay? Non-parametric is done when the data is skewed. Parametric is done on large data, and usually large data are normal skewed. Mostly parametric is for quantitative, non-parametric is for qualitative mostly. So under parametric, you have paired t-test, unpaired ANOVA and jet test. So in one of the NEET, they have asked which do not come under parametric. If you remember the 4 parametric, you can tell which do not come under it. So paired, unpaired, ANOVA, jet, they are parametric. Rest you can say as non-parametric. Okay. And to decide which test to apply, first you have to know what is quantitative and qualitative data. Quantitative are those which we can measure, like BP, cholesterol, bilirubin. Qualitative are those which can only be categorized. Like if I say my obesity, you can only categorize into mild, moderate, severe, you cannot measure it. So obesity will be categorical qualitative. All disease are categorical. If I say hypertension, hypertension we cannot measure. We can measure BP. Hypertension is mild, moderate, severe. So hypertension is categorical, diabetic, obesity, all diseases are categorical. But the things which we measure is quantitative, continuous. Second thing is, do remember, in categorical qualitative data, we use median and mode. Median and mode are here, used here. And the data comes in percentage when it is categorical or qualitative. So in any exam, let's say you found qualitative data as the outcome. Then on qualitative data of 2 or more group, we apply chi-square test. But if the data is quantitative, like BP, sugar, HB, and pre, post, before, after match data word are written, then we use paired t-test. Paired when pre, post, before, after is written in the question and data is measurable. If they say 2 group of participant and quantitative data, we apply unpaired t-test. And if they say 3 or more group, then we apply ANOVA. So let's practice this question. They said effect of yoga on percentage of infection among JRSR intern can be compared by which test? So there are 3 group JRSR intern. So if there are 3 group, unpaired t-test cannot be there. And they have not used the word pre-post in the question. So pre-post not used, before, after not used, match data not used, paired t-test gone. Now answer is among ANOVA chi-square. To decide, you have to decide whether the data is categorical or measurable. Can you measure infection? No. You can only classify it into mild, moderate, severe. Plus one more hint is percentage. One more hint is they have given bar chart here. So on bar chart, infection, which cannot be measured, percentage, all hints suggest that it is qualitative data. And in qualitative data on 2 or more group, we apply chi-square. So answer is chi-square. But in the same question, if I make it CRP level of JRSR, only 2 group, CRP level we can measure and there are 2 group, answer will become unpaired t-test. If I say CRP level of JRSR in turn 3 group, then answer will become ANOVA. If I say CRP level before and after, then it is paired t-test. Okay. So these are the test p-values question which are very confusing and come from here. The remaining part of biostat, I have discussed separately in one session on numericals for NEET. And they have asked 4 or 5 numericals, 5 numerical in last FMG exam and 4 numerical before that. So this time in NEET, and they have given calculator on the computer screen, so they can ask numerical in NEET also. So if you will revise that numerical part video on free video on YouTube of mine only, numerical, all complete numerical for NEET PG 2024, you will get to learn the remaining part of biostat there also. Plus this session I have tried to make it 2.5 hours only. So let's go and discuss about some of the smaller topic which we usually miss and confuse. That is international health, occupational health, entomology, which I said will be there. So let's go to those topic and discuss them. Okay. Junior surgeon is saying that sir आपके example बार बार मुझे single होने की एहसास दिलाते हैं. And he is saying that I am feeling like single with your example. Very good, dear. Actually, all those examples come from my experience of college life. So it makes you like that. And Deepak Pandre is saying ki, we need this video in Hindi also, in English also. Of course, I can do it in English, but I have already done a revision videos in Hindi, which is on YouTube. And but it is very too long video of 6 hours. If you combine them, then it will be complete revision in Hindi. So that's why this session I planned in English, because I have already done Hindi videos and this was there. So now let's do some of those topics which we miss, but which are very important. One is international health, and other is entomology and occupational health. Okay. So in the international health, first thing is they are asking work of some of the new organization, and they can also ask about Helsinki Declaration, about Geneva Declaration. This was the question in INICT. What is Geneva Declaration? What is Helsinki Declaration? So Helsinki Declaration is dealing with RCTs. When we do clinical trials, then while doing clinical trials on animal or patient or human, on human or animal, we should be very ethical. We should not do unethical trial on animals. That is mainly Helsinki Declaration. Okay. So all those declarations need to be revised. Do remember it. Now let's come to this organization works. One is Ford Foundation. Ford Foundation focus on sanitary latrine and National Institution for Health Administration come under it, NEHI come under it. So how will you remember it? ऐसे सोचो कि किसी ने फोड़ के हगा, someone did this big of shit that the sanitary latrine western toilet got busted out. So after that he need to take a bath, and a bath in Hindi is NEHI. So NEHI and sanitary latrine under Ford. Then there is care. Who need more care? Children. So care is needed for children, and how will you care for them? By giving food in Anganwadi and all. So care fund ICDS program, it is expected in this exam. They can ask care. Then the third is Rockefeller, who is trying to make our foundation rock solid by giving us fund for research, so that all the patent would be for India and we can earn lakhs of millions of money. So Rockefeller is making our foundation solid by funding our research, and National Institute of Virology. Okay. Red Cross, as we all know, is for war victim relief. UN-AIDS look like will fund HIV but fund malaria program. And in the exam, if you gave you this logo, this is not the logo of Red Cross. This is Suraksha Clinic. Red Cross will be completely red like this. This is Suraksha Clinic, which is for STD RTI treatment, and Suraksha Clinic, and one more thing is Mobile Medical Unit. Both are example of public-private partnership, and in both of them, medicine always come from government. All medicine from government, from public. The ambulance or building of this thing, they can be government or private, but all medicine will come from government. Again, a PYQ of INICT. Now, let's talk about some other organization and their work. One is SIDA. As per SIDA, as per Sputum, SIDA will fund for TB program. Then is DANIDA. DANIDA you can remember by Netradan, eye donation. So DANIDA, eye, dan, donation, eye donation. SIDA, Sputum, TB program. UNDP, Fund Sustainable Development Goal, SDG. UNFPA stand for United Nations Fund for Population Activity. What do you mean? Are they giving money for sex? And they are giving money for family planning programs or population activity. And it would be fun if they would give money for sex. And we would earn while doing fun. But no, it's just family planning program which they are funding. Now, next is UNICEF. UNICEF is saying United Nations International Children Emergency Fund is the full form, and it works for mother and child health. Under UNICEF, there is GOBI-FFF strategy. G stand for growth charting, O for ORS, B for breastfeeding, I for immunization, And what is triple F? First F, female education. Second F, family planning. Third F, food supplementation. And because food supplementation is one of the F, therefore, they have asked it in NEET that who funds seed and manure of applied nutrition program? That is also UNICEF. And they said we will make a school garden and fund seed and manure so that they can have fresh food in their midday meal or Anganwadi. Do you think garden will survive in a school? Very difficult. So this program did not work, but this question has been asked. Do you remember? Now, what is the target gross national product which we should give on health? 2.5% we should give on health. Okay. Then they have asked already in NEET exam last year only in 2023 about Colombo plan. So that's why I was saying that they can ask about CARE, Rockefeller, Ford this time. Colombo plan, CO for Colombo, CO for cobalt. It fund cobalt therapy unit by C Canada. Colombo plan also funded for AIIMS New Delhi. Rajkumari Amrita Kaur was the first health minister, and C opened it with the help of funding from New Zealand. Okay. Then, of course, with WHO, we just have to know World Health Day is on 7th of April. And in this World Health Day, the theme is our health, our right. So what do you think? Is health is a basic right in India? No. We have right of education, but not right of health in India till now, sadly. Okay. Now they can ask you the head office, headquarter of the organization. They will give you the logo and they will ask where is the headquarter. So all the organization with UN are in New York, except UNAIDS and UNESCO. UNESCO is in Paris. Paris had first democracy, and when the democracy came, they burned the family member of the king family. All the people of king family were burned by people. So you can remember this weird story to remember that educational, scientific, cultural work of democracy started from Paris like that. UNESCO, Paris. And WHO in 1980 said that UNAIDS, South Africa said in 1990s that WHO has created AIDS. AIDS is not a disease because no one dies from AIDS. What is the most common cause of death in HIV patient? TB. Then second is fungal infection and all. So this weird thing said by South Africa can help you to remember that WHO created AIDS, and they said it. So wherever is UNAIDS, WHO will be there. And WHO we all know is in Geneva, and the same capital there is also UNAIDS, Red Cross and ILO, not love organization but labor organization. So all UN New York except UNAIDS, which is with WHO in Geneva, and UNESCO in Paris. Other than that, FAO, Food and Agricultural, is in Italy. I asked in one of the class, what does FAO mean? A student said, sir, fuck off. I said, man, why are you saying me fuck off? He said, sir, you itself has written Fiat Panis. Because in the logo it is written Fiat Panis. I said, man. He said, you have written flat penis. So I said, fuck off. I said, no, man, it is not flat penis. It is Fiat Panis, which means let's break the bread together, not break the bed together. So what is the headquarter? Is in Italy, because what is our favorite food which we will order? Pizza and pasta and all. So it is Italy. Anyway, many people like me, they like Italy also. Idli. So Italy food is very simple to remember. Where is the headquarter of World Bank? World Bank is in Washington, DC, because international currency is dollar. So World Bank is there. UNDP logo is very difficult to identify. Remember, this is UNDP logo which give fund for SDG. And where is the headquarter of UNDP? All UN New York except UNESCO in Paris and UNAIDS in Geneva. Okay, if they put snake and ladder in the same logo of UNDP, it will become WHO. So these are the logos and all. Do you remember? Now, in the international death certificate, they only ask one question, that which line is most important? Line 1C is the most important because it writes the main underlying cause of death. It is known as hurt of death certificate. Then in sustainable development goal, we have revised it many times that the third goal is for health. And you have to remember 70, 12, 25 for MMR, neonatal 12 and under 5, 25. 1/3 should be reduction of premature cardiovascular death. And by 2030, all TB, malaria, HIV should go away. Okay, but because they have put only one target for 2020, that is accidental death should be half by 2020. And this target was achieved in 2020 because Corona came in 2020. Accidental death became half actually. So one target achieved only for 1 year, that is accidental death. Rest all not yet achieved and are less likely to be achieved by the way we are progressing also. Now, when it comes to bioterrorism agent, they only ask question from A or C. In the C, there is Nipah and Hanta. With Nipah, they have already given this question where they give a date palm tree with fruit bat flying, and who is this animal below? Pig. So Nipah is transmitted by date palm sap and pig. That's why it's there. Nipah, Hanta, both are category C, newer agent. In category A, most commonly they ask either anthrax or botulinum. Again and again they have asked it. So anthrax, botulinum, A. Then two is disease which has already been gone, smallpox and plague. Then two disease which are transmitted by origin by fruit bat and in which bleeding occur and patient die, Ebola and Marburg. Conbola, Ebola. Ebola and Marburg are viral hemorrhagic fever. Smallpox, plague are old disease. Anthrax, botulinum, new one. So like that you can remember 6. Now the 7th one is tularemia. Tularemia is disturbing the flow. Yahi bhadwa hai. He is disturbing the flow. Rest all are very easy. 2, 2, 2. You can remember them together. Okay. So these are there. And fruit bat not only give rise to COVID, it also give rise to MERS, SARS, Ebola, Marburg, Nipah, Hanta, all come from fruit bat. In MERS, the intermediate host is camel. In SARS, the intermediate host is civet cat. And they can ask that what is the most common complication with COVID vaccination? So the most common complication with COVID vaccination is venous thromboembolism. Okay, we have discussed it in vaccination in our last session. That's all from international. We can revise occupational health quickly as well. Remember, in factory hack, any place where 10 or more people work is factory, and the space should be 500 cubic feet, but only above, up to 14 feet above head is counted, not above that. In a school program, remember the space per student was 10 square feet. Then they say for every 1,000 we need safety officer, 500 welfare, and 250 canteen. You can remember it by mnemonic SWC, southwest corner. Safety 1,000, welfare 500, canteen 250. Anyway, safety should be first because Savdhani hati, Durghatna ghati. Safety should be first because if safety removed, accident can occur. So safety first 1,000, then welfare 500, canteen 250. If they ask maximum work per day, don't write 8 hours because Park has written 9 hours including 1 hour break. If they say maximum work hour per week, people answer 60. You will not answer 60 till overtime word is written in the question. If you find overtime word, only then write 60. Otherwise, you will write 48 hours. So this question has been asked in PYQ. Per week is 48 hours. If they say overtime, then 60 hours. And no child below 14 years can work. You all know. Now, when it comes to ESI, 0.75% of total monthly premium of ESI come from the workers. 3.25 come from the employer. 1.8 from state government. 7.8 from central government. So, who is the main funder? Central government is the main funder. Central government give around 83% fund. 7/8 come from central government. Okay. Then the sickness benefit is of 91 days. They have asked the question, what is extended sickness benefit duration? It is 2 years. But if they will trick you by asking enhanced sickness, enhanced is not extended. Focus on the difference. Enhanced is for 7 days when you cut my wire, vasectomy if you will do, and for 14 days if you cut my wife wire, tubectomy if you will do, it is 14 days. And of course, which one is easy to do? Vasectomy, because it is already hanging down, so easy to cut. That's why the leave is of 7 days, and these are enhanced sickness benefit, extended for 2 years. Funeral expenses is 15,000, dependent disability is 90%, and maternity benefit is 6 months. So very intelligently, in one of the MCI exam, they asked that, what is the duration of maternity benefit? 24, 26, 28, 30. People thought 24 because 6 months. But then there are some Saturdays, 28 days is only 4 weeks. Na? So the extra day will count for 26. Remember, maternity benefit 26 weeks. Second thing, when do we take random blood sugar? The ideal time is 24 to 28 weeks. But if they ask one answer, you will answer 28 weeks when we take random blood sugar, because we are detecting gestational diabetes which occur due to pregnancy. So it is detected late in second trimester. Okay. Now we will talk about respiratory occupational disease. Recently in UPSC is in mica and pottery industry, pottery industry, which disease occur? So all the factories which are related with soil or stone, they will have silicosis, which is the most common pneumoconiosis. And in silicosis, an X-ray appearance based question came in UPSC that in mediastinal area, you are seeing egg cell like deposition. Egg cell like deposition means they are talking about calcification. So this calcification occur in silicosis, and silicosis is in mediastinal area. Silicosis occur in cement, tiles, factory, all worker. But if they give you that on X-ray, you are finding deposition on peripheral area of X-ray. So the peripheral area of X-ray include pleura, and in pleura, mesothelioma cancer can occur with asbestosis. Okay, in asbestos factory worker, this can occur. Stenosis occur in tin factory, siderosis occur in iron factory, anthraconosis occur in coal factory worker. In just last MCI exam, they have asked biostenosis occur in which worker? In cotton factory worker or textile factory worker or jute mill worker. This part which I have circled in black is very important to remember. I'm expecting one question in this part in NEET exam this time only. Bagasosis is not only for sugar factory worker, sugarcane factory worker, but also for cardboard factory worker. But they will ask the causative organism of bagasosis. Student remember saccharide, but they will not ask the last name, they will ask the first name, that is thermoactinomycetes, which lead to bagasosis. Farmer lung occur with micropolyspora faini. Okay, micropolyspora faini. F for farmer, F for faini. And farmers are usually micro industry, small level workers. So micropolyspora in farmer and thermoactinomycetes in bagasosis. Okay. Now, these are the respiratory disease. We all know Minamata disease by mercury, plumbism by lead. And they have asked in NEET what is the most common route of lead poisoning? Inhalation. By when you take in the ray. These are the symptoms of lead poisoning which you can remember by A, B, C, D, E. They have asked recently that basophilic stippling of RBC occur in which illness? So basophilic stippling means inside the RBC there are granules. That is basophilic stippling. Okay. And Burtonian line means on the gum. These are teeth, suppose, and this is the gum. On the gum, there is blue lining on the gum. That is Burtonian line. Both occur in lead poisoning, and the drug of choice for lead is Edita. Okay. So that's all from occupational health and all. Now we can revise entomology. Very important area because question not only in PSM but PSM micro both ask question from this part. So in the entomology, first question which has been asked is patient come with inflamed buboes. What is the causative organism? Answer is Yersinia pestis. Buboes means lymph node. Buboes is indicating bubonic plague. Causative organism is Yersinia pestis, but bubonic plague is transmitted by rat flea. Other disease transmitted by rat flea are hymenolapsis and endemic typhus, which is also known as murine typhus. So to remember the disease transmitted by rat flea, this insect, you can think that on the rat flea, Chota Bheem is sitting. I was teaching it in one of the class. Students said, sir, Chota Bheem bada ho gaya hai. Chota Bheem has really grown up. I said, no, bro, it is not Chota Bheem part. It is her gada, the device by which he fight and all. So in this Chota Bheem, why I made the mnemonic Chota Bheem? Because there are two types of typhus, endemic and epidemic. We will read later on. Epidemic typhus is transmitted by our childhood friend louse. Epidemic louse. Endemic is rat flea. And just like Chota Bheem is our local hero, na? Chota Bheem, Chota Bheem, Chota Bheem, Bheem, Bheem. It is not in other country. It is in India. Local hero. Endemic. So endemic typhus by rat flea. Chota Bheem is the logo for that. Bubonic plague, hymenolapsis, BHEM. Murine typhus is the name of endemic typhus. This is by rat flea, endemic typhus. Now, second thing is they will ask mite. Mite image is glossy and all you can see. And for mite, in my MBBS time, I made the mnemonic PSSM. PSM sada hua. Because I used to hate this subject a lot. P stand for rickettsial pox. S for scrub typhus. Second S for scabies. You might think, sir, have you smoked or what? Rickettsial pox start with R. Why you made mnemonic P? Because R also is there in relapsing fever and a lot of rickettsial disease. But P is here, which we can remember. So pox, scrub typhus, scabies. But in one of the class, a student Anil said that, sir, RSS can also be made pneumonic, na? I said, okay, it's up to you whether you take RSS as might or PSM as might. But main thing is remember the illness. RSS, PSM, both are by might, rickettsial pox, scrub typhus, scabies. And I hope you all know, scrub typhus is caused by Orienta 𝐶𝐶𝐶𝐶𝐶𝐶𝐶 gambusi. And they ask it very commonly. And although it is transmitted by mite, but there is a special type of mite which transmitted, that is trombiculid mite. Okay. And in exam, if they give you any image that there is track formation, it is definitely scabies. Second thing is, if they say that other family member infected, this is also scabies. And scabies, you all know, is caused by Sarcoptes scabies. The worm is Sarcoptes scabies. And the transmitting agent is mite, but we call it a special type of mite, itch mite. And of course, the drug of choice for scabies is pyrethrum. And drug of choice is pyrethrum. So do remember this track, if they gave, that is definitely scabies. Is being asked recently also. Both this trombiculid mite and track question has been asked. So do remember it. Now, let's talk about this red velvety mite, chigger mite. If you have rolled in grasses in post-rainy season and all, you might have seen this mite, chigger mite. It transmits chiggerosis. So simple. Let's talk about our childhood friend louse. It transmits 4 diseases: pediculosis, epidemic typhus, relapsing fever, trench fever. So to make it remember stuck in our mind, the mnemonic is PERT. The logic for this mnemonic is, if you remember your childhood days, when you used to take out the lice and kill it, it used to produce the sound of PERT. So the mnemonic is also pediculosis, epidemic typhus, relapsing fever, trench fever. And these days they are asking a lot of questions from epidemic typhus. They will create you a clinical picture that patient after insect bite develop fever with rash. What is the illness? Illness is epidemic typhus. 95% time, if they say human infect bitten by insect develop rash and all, then that is epidemic typhus. But who is the causative organism? Rickettsia prowazhii. Okay. Nikhil, door close kar lena ek baar. Nikhil bro. Nikhil. अरे यार. Okay, so close the door. वो आवाज आ रही है तुम्हारी फोन की. So do remember, if they create a clinical picture of a man bitten and all, the causative organism will be prowazhii, transmitting agent will be lice, disease will be epidemic typhus in 95% cases. Now the point is very easy to remember this thing. See, I discussed endemic typhus is by rat flea. And who is the causative organism of endemic typhus? Endemic typhus causative organism is Rickettsia typhi. So see, my dear friend, typhoid is local endemic in India. So typhi endemic, transmitted by rat flea. Rat is also in our country and BAME is the mnemonic also. So typhi endemic and prowazhii, power, epidemic. Louse prowazhii. Okay, epidemic typhus. Okay. Now we will see this. Imran asked me of insect kingdom, redwood bug. You will identify it with this pout. So eager in kissing that it takes out, the pouting part is always out. So sometimes they give the image of a brown color insect with pout. That is also redwood bug. You will identify it with this snout coming out. And it transmits only one disease, Chagas disease. So in one of the class, a student Kamlesh suggested me this mnemonic that, sir, we can remember it very easily, that redwood bug give Chagas chumma, and redwood bug give very good kiss, because it is also known as kissing bug, and Chagas means very good. Very good kiss. Redwood bug, Chagas kiss. And why they call it kissing bug? Because this is so turkey, so pervert, that it only like to bite near lip. Imagine if you'd like to bite at any other hole, what we would call him. So it's kissing bug. Now we will talk about soft tick, hard tick. Pronounce the name carefully. So what is the difference between a soft tick and a hard tick? How will you identify a hard tick? Tell me. When I ask it in class, mostly students say by touching it. you should not touch hard tick all the time. The best answer is in hard tick, head is visible, because the covering goes back, head is visible. But in soft tick, head is covered behind the skin covering. You cannot see the head. So remember, this is the soft tick in which scutellum or back covering cover it. In hard tick, you can see head is coming out. And tell me, who will have long legs? Hard tick will have long legs, because in soft tick, head and leg both are covered in the back covering. So soft tick, no head. Hard tick, head visible, easily to identify. And same as hard tick, there are ixoid tick or deer tick. This ixoid or deer tick, it transmits two diseases, Lyme disease and babesiosis. In Lyme disease, this type of lesion will be given. This is known as bull's eye lesion. In babesiosis, this type of cross can occur. This is known as Maltese cross. So if they give peripheral smear of babesiosis with Maltese cross, who is the transmitting agent? They will ask, who is the transmitting agent? Ixoid tick or deer tick? Lyme disease, who is the transmitting agent? Ixoid tick or deer tick? Okay. This was the question in NEET 2018. They gave the image of Maltese cross. They asked who transmitted? Ixoid tick. Okay. Now, soft tick transmit two diseases, Q fever and relapsing fever. But it was a very common question at our time that which rickettsial disease is transmitted by air? Answer was Q fever transmitted by air. And then relapsing fever, we just read PERT, pediculosis, epidemic typhus, relapsing fever, trench fever, PERT. So relapsing fever is also transmitted by louse. That's why the mnemonic for soft tick is QRS complex. Q fever, relapsing fever by soft tick. And why it is complex? Because both of them are transmitted by some other agent. So the only three mnemonic I have gave you is PERT, PSSM, BHEM. QRS, even if you forget, it's okay. But do remember BHEM for rat flea, and do remember what is inside the mnemonic also. Bubonic plague, hymenolapsis, endemic typhus, murine typhus. PSSM for mite, PERT for head louse. Now, if you look at the flies, this is half black, half brown, domestic house fly. This is full black, black fly. Then these two are brown color fly. These are known as TC fly or CC fly. This CC fly, scientific name is Glossina palpalis. And when we are talking about palak or palpalis is related with sleep. So which disease Glossina palpalis will transmit? It will transmit sleeping sickness. If you saw a fly with hair-like structure on body and wing, that is sand fly. And this feather-like structure, when you see it from distance, it will look like sand on the body of sand fly. That's why they call it sand fly. And both are sand fly image. And this is a live one, this is a killed one, but both are sand fly. How will you identify it? By this hair-like structure on the wing. And second thing is sand fly have very long legs. Long legs is also there in sand fly. Sand fly transmit 4 illness, Kala-Azar, which is visceral leishmaniasis, in which visceral leishmaniasis have darkening of skin. Do remember, which occur with clofazimine. It also is a symptom of Kala-Azar, and they will give you the feature of hepatosplenomegaly in visceral leishmaniasis. Hepatosplenomegaly, very commonly asked, is occur with fever, hepatosplenomegaly, and darkening if they gave. Kala-Azar diagnosis confirmed. The diagnosis of Kala-Azar is done by a RDT kit RK39, and Kala-Azar occur in 4 states only in India. It is endemic in 4 states. Of course, the most cases occur in Bihar. Then there is Jharkhand, the brother of Bihar. Then there is UP, neighbor of Bihar, and West Bengal. 4 states are endemic. Assam is not endemic for Kala-Azar. Okay. So, other than Kala-Azar, topical leishmaniasis, oriental sore, or Aya fever, these are the 4 illness transmitted. How will you remember it? Just by saying one word with me. Say it with me. Oh, Kala-Azar. Say it. Oh, Kala-Azar. And you will remember it. Oriental sore or Aya fever by Kala-Azar. DDT and pyrethrum cannot kill it, so it can pass through insecticide treated net also. Okay. Now let's talk about one very controversial question. They ask, who will have a spotted wing? And all the students, they directly tick Aedes, thinking Aedes have a spot. But Aedes don't have a spot on wing. Wing is spotted in case of Anopheles. You can see the spot there, which I have pointed here. These are the spot. So, kiski chunri mein laga hai daag, that is spotted wing. And Anopheles is also known as sophisticated mosquito. Why? Because it breed only in clean water, okay? No dirty talking, no dirty water. One more reason why it is sophisticated is, while biting na, it first lifts its ass and then bite. That's why it is ano and then philus. So you can identify it doesn't like to touch our dirty skin. Okay, when biting, it bites at 45-degree angle. That's there. And then there is urban, rural, and forestry malaria, which is very easy to remember. See, fancy people live in urban area, so stay fancy, urban malaria. Cow, buffalo, milk, it is more in rural area, so 𝐄𝐂𝐓𝐈𝐎, calcium more in rural. And where will you find flowers and all? In hilly forest area, so fluviatilis, forestry malaria. And you can remember it. Aedes, we all know, is the daytime biter, and it has black-white stripes on body, but you can see there is no spot on the wing. Aedes transmits 5 diseases, very easy to remember. CD for chikungunya dengue, YZ for yellow Zika virus, and last is Rift Valley fever. So if I am a pregnant female, suppose, and I develop Zika virus illness during my pregnancy, then what will happen? तो मेरे माँ लौंडे की होगी छोटी मुंडी. My child will be born with microcephaly, and then there is also GB syndrome which can occur with Zika virus. Okay, 𝐄𝐄𝐋 mosquito. I missed to give you the image here. Will have 3 things. First thing, when 𝐄𝐄𝐋 sit, it will have a hump, not bump. The hump. That means 𝐄𝐄𝐋 will sit in this posture while biting. Second thing is 𝐄𝐄𝐋 will have hair on the back. Third, it will have golden brown bump. So hump, hair on the back, golden brown bump. It is 𝐄𝐄𝐋 which transmit 3 diseases: J. filariasis, West Nile fever. J. filariasis we can easily remember. We get confused in West Nile and Rift Valley. So to remember it better, one of the students, he gave me this trick that sir, we can remember West Nile as West Nali. Nali, and Nali means sewage water. So because 𝐄𝐄𝐋 breed in dirty water, that's why we call 𝐄𝐄𝐋 as nuisance mosquito. And 𝐄𝐄𝐋 is known as nuisance mosquito because it breed in dirty water. So that's why Nali fever, West Nile fever, sewage water is Nali. So Nile or Nali, you can mix them and you can remember that West Nile by 𝐄𝐄𝐋, Rift Valley by Aedes. If you give them the image of a larva which is floating parallel, that is Anopheles. Okay, and we need not to go into eggs and all. They very rarely ask it, but in micro they might ask it that the egg, when it comes to the egg, Anopheles and Aedes start with A, and A also means alone. Egg of Anopheles, Aedes are single. C for 𝐄𝐄𝐋, and C is also for cluster. So 𝐄𝐄𝐋 lay egg in raft, because many of you have done river rafting. Have you done river rafting alone or in cluster? Cluster. So 𝐄𝐄𝐋 egg is in cluster, Aedes Anopheles alone. Then when it comes to the larva, remember floating larva is of Anopheles, because there is a body part in our body also below the body which is hanging and useless mostly. Which part is below the body, hanging and useless? Appendix, hai? So that appendix is rudimentary, useless. Similarly, in the larva of Anopheles, the breathing tube is very small, useless, rudimentary. So the larva of Anopheles has to come on the surface to breathe. But Aedes and 𝐄𝐄𝐋, they have big Eustachian tube, big breathing tube, so they can breathe while hanging. So if they give parallel larva, that's definitely Anopheles larva. Hanging larva can be Aedes or 𝐄𝐄𝐋. Similarly, if they say gametocyte, you can see banana-shaped gametocyte, falciparum, headphone-like gametocyte is falciparum, and granulated RBC gametocyte is vivax. So if they give you this image, that is definitely falciparum. Okay, so that's all from entomology also, and we have discussed it already that main host in case of hydatitis, toxoplasmosis, malaria is dog, cat, and Anopheles. So we have done the revision of all the health programs, occupational health, international health, and entomology. We will be ending this session here, and if there are some 1-2 small topic left, we can have a short videos on those and we can update you there. I'm very happy with your response and all. Some of the students said that I am not fat also. Some said I am looking good, handsome also. Flying kiss to all of you. Mwah. Thank you so much for appreciation. But of course, that was good. Thrombocolid mite, scrub typhus. Yes, Dr. Raju Prasad, you are right. And then if you have any other question doubt, you are free to ask it. Otherwise, we will meet next time. Till then, keep rocking, keep smiling, and keep doing PYQs in your last 4 or 5 days. The more PYQ with topic you do, the more fruitful you will find it in the exam. Okay, so hasta la vista, das vidania.